And welcome to the January 13th school committee meeting. Start with Pledge of Allegiance. Stella Austin to lead us in the Pledge of Allegiance.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay. We have a consent agenda from our December 16th, 2021 meeting and oath of bills and payroll. I did want to make one correction to the minutes before we make a motion on that. Justin, I should point this out to me earlier today. There on lines 95, 96, it states that it's basically paraphrasing what I said, says I do not think it is a mental health risk for them to be wearing a mask all day at school. That's not really when we went back and watched the video, what I said was, do I think that wearing a mask is the sole reason kids are feeling depressed or anxious? No, but it is certainly a facet of the anxiety and depression. So I just want that to reflect that I don't think, I think that wearing a mask does have an impact. I do not think it's the only impact on mental health. But other than that,
I have two additional ones.
okay.
Since I went through them, I believe it's line 82. I just think it should reflect the minimum case count of 3 positive cases. I know that when you went over it, Dr. Clenchey, the slide had 4, but the discussion revolved around 3. And also line 105, it says, I do not think it would be right to exclude a student from taking part in this program just because they have had COVID and therefore cannot yet be vaccinated. It should instead, just because they have had COVID and can not participate in the test and stay program. So I know Bettina does an excellent job with this, and just as I was going through them, there were a couple things that needed to be corrected. So
Yeah.
Thank you very much.
Good catch. There's no public record. Given those edits, I'll take a motion to accept the oath of bills and payroll and minutes from December 16th.
I move that we accept the oath of bills and payroll and minutes from Vaccination.
Motion made in second. All those in favor?
Aye.
Those opposed? Guys have it. Moving on. We have, this is our first opportunity for interested citizens. Is anyone on the line, Dorothy?
No, we do not have any.
We'll move on to Stella Austin, our student representative. She can tell us about the happenings in all of our schools.
So hi, my name is Stella Austin, and I am the student representative from Littleton High School. At Shaker Lane, they recently concluded their Coats for Kids and Families Drive. They collected 134 coats for families in need, and they thank everyone for their generosity and kindness with this compassion project. Shaker Lane is also very excited for their PTA hosted virtual dance party next Friday evening. This event was a huge success last year, and they look forward to seeing many students and families dancing right away. At Russell Street, they had a strong return after break. Students have done a great job managing their indoor recess days due to the cold. And Russell Street students are also looking forward to the PTA sponsored virtual dance party night for next Friday. Littleton Middle School Band and Chorus has hosted their winter concert last month, which was a great success, and they want to thank everyone for making it such a wonderful night. And Littleton Middle School also has their math testing next in January on the 26th and February on the 9th. So they would like to remind everyone to bring their Chromebooks charged. At the high school on January 8th, world language students participated in world language proficiency testing, which can kind of indicate their strength in their languages that they're learning. Yesterday was a half day for the students, but the faculty participated in professional development. Theater at the high school is back up and running, and they just started rehearsals for their spring musical of Cinderella, so look forward to that. Sports are also back up and running and going strong. Yesterday, the boys track team won their meet with 77 points to 14 against Littleton, and the girls won 75 to 18. So our sports are going really well. And lastly, the high school band is also preparing for their Disney trip over February break, where they will be performing and participating in workshops at Walt Disney Studios. And everyone is like crossing their fingers that COVID numbers allow for the trip to proceed.
Thanks, Noah.
Good job.
Can I ask for a question?
Sure.
So I do have a question. It's weird that it's you, but we've all seen the numbers the last week or so about people missing from school. And I'm wondering if you could tell us, or maybe the other students in the room could tell us something about what the vibe is like. Like, how does it? Can you feel it?
I mean, it's normal in school to have students missing from classes just day to day with or without COVID for doctor's reasons, for whether they're sick or they have family commitments, or just whether they're just not there. But there have been a lot more people absent lately. Personally, in my classes, I haven't noticed too much, but overall, the school does feel a little emptier. But not that it's made a huge impact on my experience.
I also want to take the opportunity to welcome Mr. Schcmte and his government class from the high school. They came here today to learn a little bit about our local government and see what we do here. I tried my best to answer some of their questions, but if they have any questions right now, I'm happy to answer them, or they just want to observe and see how we do things here. And this is one of the pieces that I kind of missed from our in-person meetings. We missed out on while we were doing online for a year and a half. Now that we're back and doing hybrid, we can have classes in and they can come. And, this is something we look forward to. So welcome and enjoy the
Enjoy the meeting.
Welcome, Alex.
all right. Dr. Clutchy, wanted to give an update on the January 10th vaccination clinic.
Sure. First of all, Happy New Year, everybody. It does feel strange saying 2022, but another week or so, it'll just flow quite nicely. We had a successful vaccination clinic on Monday. All slots were filled once again, and the pacing of the clinic, the more clinics we do, the better the pacing it is. I mean, it's actually, I felt it was slow, but it was perfect, but I'm just not used to slow. So when I was there, I talked to the owner of the company, and we arranged 3 more clinics because there's still a need in our community. So we have one next Tuesday, January 18th, second one, February 7th, and another one, February 28th. Yeah, just a second here, my writing is off here. Yeah, 28th. That's right, Dorothy? Good. The clinic focuses on first and second doses of Pfizer for pediatric ages 5 to 12. First and second doses of Moderna vaccines and boosters for 15 and over. And Pfizer boosters for 12. So we're trying to hit a wide variety of individuals in our community that they need a booster, a second or a first dose. Our vaccination rate in our community is actually pretty high right now. So it's a good place to be in as we move forward. The clinic on Tuesday, it's the first time that it didn't fill out within 20-25 minutes. In fact, 24 hours later, we have 4 slots left. So it gives us some indication that we're starting to get to the point where we want to be. So hopefully with the 3 other clinics, we'll be in really good shape. We'll assess it at the end of that, and if we need more, we'll certainly organize. We're right on to the next
Well,
item.
can I just say that how much we appreciate the work that you and the town administrator are doing to make these plans available.
Oh, thank you.
It's really important.
It is.
Oh, thank you. It's nice seeing people out, and it does give people an advantage to be able to being able to go in their community, not drive far, and get vaccinated, and go on with their evening. So appreciate you saying that. School startup after holiday break. It actually started prior to holiday break. It was about Tuesday of the last week of holidays where my email started filling up and my phone started ringing. And it actually kept me busy as I was driving back from Canada. So it was kind of a nice distraction, so to speak. As we all know, Omicron took us by surprise and the infection rates started to soar quite quickly. A lot of trepidation about, what are we going to do? How are we going to prepare for the first day back? And what's the best way to go? The state offered us some masks, and I'd like to thank Steve for taking the day out of his holidays to go down and pick them up. Steve and Bill Maher also had them all sorted and ready to hand out the first day of school. So appreciate Steve taking the time to do that. So made the first day go much smoother. For a few of us, Wednesday we had an emergency meeting with the commissioner. And at that time, we were informed that they had ordered a number of test kits for staff. And then 4 hours later, we found out that the company that was supposed to deliver them wasn't going to deliver. So we didn't know what was going on. They found another vendor and ended up getting tests. We actually ended up picking them up Saturday, New Year's Day. Friday, New Year's Eve, we were mapped out a way that we could administer tests. So Saturday, we picked up the tests, and then there were 2 tests per kit. They only received half the orders they had hoped. So Lynn and Dorothy and I spent New Year's Day ripping the kits apart and making individual kits for all of our staff. So we were able to get that done. Then Sunday, we had a drive-through for our staff, very well attended. We had an 86% participation rate of all staff. So very pleased that our staff were able to come out and take part in that program. Out of all the people we tested, we had 7 positives, so it was a nice sign. But it also gave us certainly some security as we were going into Monday, because we knew that most of our staff would be there. And one of our biggest concerns when you have any type of pandemic is making sure that you have enough staff to keep your schools open safely. So far, so good. We're doing it. It was touch and go in a couple of days that first week in terms of having enough staff. But credit to the administration and teachers for all pitching in and making it work. Our numbers, as you know, have been higher, and they certainly mirror what's happening in our community. But we're okay, and our numbers this week are starting to go down. I'm not convinced that we've reached the peak and we're on the other side of it yet, but I'm convinced that within the next 2 weeks, we should be starting to see lower numbers and hopefully get back to normal by the end of February. What we define as normal through a pandemic. So first day back, I was in all the schools and I was just amazed how quickly everybody settled into learning. Less than an hour, everybody was back into the swing of things. Kids were engaged in lessons, and it's just a nice feeling considering what we went through prior to the start to actually have it done and see how quickly everybody adjusted to coming back to school.
I'd also say it's not as having the change over the break going from the 10 days to the 5. It's not as disruptive for some of the students who have tested positive for COVID. I think if they were out for the entire 10 days, we would have seen that would be able, but it's nice that given the changes in the Omicron with the vaccinations, we're seeing people recover a little quicker. They were able to get kids back in school sooner.
Yeah, I'm glad you mentioned that, Matt. I mean, that's made a huge difference. Omicron's a different kind of variant, though. We're finding, and again, it's only our local data, but a number of people aren't testing right away when they have symptoms, testing 1 or 2 days out from there. Then we're having a number of individuals who elect to test day 6, and we do encourage that. It's not mandatory. But we have more than we ever suspected testing positive on day 6, 7, and 8. So kind of interesting how this virus, every mutation of the virus is so different that we're on the right track. And having that 5-day isolation and then strict masking for 5 days seems to be working really well for us. The contact tracing has been a nightmare with the number of cases that we have. Kudos to our nurses for hanging in there. They've been at work 11 o'clock, 12 o'clock at night trying to get contact tracing done. Lynn and I met with the nurses tail end of last week, and we're able to streamline our close contact tracing process, and it is making a difference already. So again, in 2 weeks, hopefully our cases will be sliding and contact tracing won't be as difficult as it has been. Very good.
I did have a question, but you started talking about it then. You're talking about staffing. I wonder if you could speak to our ability to staff the classes, to have teachers in all the rooms, if we're near the breaking point or if we feel very comfortable. I'm especially interested in how we are with nurses. I know we have 5 or 6 maybe for the district, and it seems like if 1 or 2 had to miss, that we'd be vulnerable there. Could you speak about that staffing?
Yeah, we're vulnerable every day. I mean, there are not a lot of subs out there, but you know, we do have a pool of subs that have an alliance to us, which helps. But I mean, Dorothy, you could help me with some of the absences we've had. I mean, one day we had 21 staff away.
Yeah.
And that was a tough day.
That's for the district?
Yes,
Okay.
trying to make everything work. But you know, we're able to change schedules, utilize an assistants, utilize other staff that are delivering services, etc. And we made it work. But there was one day, I think it was the day I sent the school committee an email. I wasn't sure whether we were going to make it the next day without having to perhaps shut one of our schools down because we just didn't have the staff to make that run. But we figured it out, and we keep moving forward.
If I can just add on to that real quick. In addition to teachers, some of our support staff, we're having issues with some of the support staff as well. So we're having issues keeping custodial staff in. We have a couple out now under the COVID protocol. The Tigers Den program is very short staffed, and we're manipulating that and doing that. But that's something to watch out for too. So it's hitting everywhere, not just the classroom, but the after school program as well, and the custodial staff and the kitchen staff and everything else. So yeah.
Well, in the CPAC meeting earlier this week, we were talking about, wondering about the implications for special education and delivery services there. I don't know if there's a comment or anything.
Well, I would say we feel good about the services we've been able to offer through this. I mean, there are a lot of school districts out there that virtually had to stop a lot of services, but we haven't. But it's through, you know, the dedication of our staff, the administration to do whatever we can to make it work. And we had some people in our community sign up to sub as well, which was very helpful. And, I mean, look, it's going to take years before we have an adequate supply of subs again. So even post COVID, we're going to have to be careful when teachers are away, paraprofessionals are away. I'm asking our principals to be a little more structured when they're dealing with time off with staff for PD, et cetera, and we're short. You know, maybe we're going to have to make some changes, and PD is going to have to happen on the day, et cetera. So, no, I'm not concerned at this point in time with service delivery of special ed services at all. So
We appreciate what everybody's doing to make this work.
thanks to everybody that's helped make this work. This is an opportunity for a bit of a plug for Tigers Den. We would love some juniors and seniors to work at Tigers Den. The wages are pretty good, hourly wage, and we're now offering a scholarship amount to be decided if you choose to work at Tigers Den from now to the end of the year. So it'll be a great experience for you. Put on your resume, and it would certainly help us out a lot too. So please spread it to your friends out there, and hopefully we'll have a few people sign up for Tigers.
So he's talking to you guys back there.
And Mr. Mosquitas, if you'd like to spend a little more time here, we could probably fit you into.
All right. We're going to move on to new business. Trina Hagberg is here to give an update on the COVID-19 public health metrics.
Thanks for pulling up the slides. Can you hear me? You guys got me. I don't have to stand today, so this is nice. Eventually, when this is all over, I'd love to be here for something happy. Can we arrange that? Okay, good.
We will.
Should we go to the second slide? All right, so the last time I was here, we were just talking about Omicron. It had been newly identified. We were still learning. Multiple countries were just starting their ascent up, so we didn't know anything. And at this point in time, we've learned a lot rapidly in a few weeks, and it's pretty amazing actually what has been learned over this time. So at this point in time, Omicron is here and now represents about 95% of all genomic sequences conducted in the US and also in New England. We need to kind of hold two different concepts in our hands as we look at the data. On one hand, Omicron seems to be less severe for most individuals compared to the prior variant. Now, keep in mind, less severe doesn't mean that the infection is easy for everyone, but it means that most people can handle it at home, which is awesome. Symptoms appear earlier in the infection than they did for the prior variants, and often before the individual, specifically vaccinated individuals, test positive. So that's also another sign that our body's immune reaction is jumping and fighting the virus early into the infection, and those symptoms have changed. So we're seeing more fever, sore throats, runny noses. Those are the symptoms that your immune system is on the attack, versus symptoms like the loss of taste and smell and the respiratory issues that were more consistent with cellular damage later on down the line. So it's great that these symptoms are much more upper respiratory tract illness kind of things we're seeing. One of the hardest things I think we're all experiencing right now, especially after we've heard this description, is that because Omicron is that significantly more transmissible than Delta was, and that is causing significant spread and strain for our healthcare, our schools. You know, there's empty grocery shelves because every system is being stressed by the number of people who are sick at the same time. So we are in the middle of our surge, and this is the hardest point I think we're going to have. We go 2 more slides to the state data. I'm going to only quickly pause on this first one. Just if you take nothing away from tonight, just know that everything's on the way up at the moment still. If you go to the next slide, I do want to dive in a little deeper so you guys can see a little bit closer because there's some changes with Omicron. So on the left here is the test positivity over a 6-week period. That's from November 28th till current. Test positivity in our state is currently around 22%. Now remember that test positivity is a measure of the total number of positive tests divided by the total number of tests conducted. This is not people. This is not a proportion of people who are sick. This is tests. Test positivities gives us an indicator if there's enough testing being done and reported into the system that we can reliably take the data on cases and say this is as complete. Is this complete? Like, do we think this is complete? So test positivity of greater than 10% indicates that there are more cases in our community than our data is capturing, which is what's happening here. And there's lots of reasons for this. Part of this was the recovery from the holiday lag in testing, and there's delays in reporting of testing now. That's like 4 days out at this point instead of 2. There's definitely more use of at-home rapid antigen test kits, which is great for the people who need to make the decision right now, but that does not mean that they all get into the data. And then Omicron is just all around. So there's just more of it and it's out of control. So all of these things are contributing to this number being higher than it has been in the past. So on the right are the cases, and this is the last 6 weeks, the same period. And Mass is currently averaging around 20,000 cases reports a day, which is significantly higher than we've seen ever before. You can see in this that the reporting delay is 3 to 4 days at this point. So people get tested and it takes more days than normal to get into our system. The system is overwhelmed at this point. So this data most recently, the last 3 days, maybe 4 days is incomplete. And we know based on the test positivity that this is an under count. And I've already heard from multiple people around town and various physicians that because we're not capturing all of the cases, that this data should just be completely disregarded and thrown in the rubbish bin. And I'm going to respectfully disagree with that. So I know that this data is an undercount, but nonetheless, the number of cases we measure continues to trend higher and double week after week. And that's telling us important information about what's happening. COVID is spreading rapidly, and it's spreading in these areas where we are measuring it. And also because there's reporting requirements for some sectors, the reporting is better for some groups than others too. So if we do the next slide, one of those sectors that are some age groups are actually better reported than others. And part of that is because schools, colleges, long-term care facilities are required to report to the state. And that means data for some of these age groups is actually reasonable estimate. And the case numbers for groups that don't have these reporting requirements are most likely an undercount, but again, the number of measured cases continues to trend higher for everyone at the same pace. So I don't think we're that off in any one age group. So at this point in time, the highest case rates are concentrating among the 0 to 49, maybe 59 age group. That's those family household units that you expect to see, given household transmission, to be impacted the most. And the rates for the older age groups are actually higher as well than any other point in the pandemic, but they're at this point in time. We go to the next slide. This is the hospitalizations. So at this point, the 7-day average for number of people in the hospital is about 3,000 a day. And looking at the ICU and intubations, there are a similar level to what they were back in January 2021. A little higher for hospitalizations, but the most severe ones are holding around the same level. So while these are at an all-time, like these cases are at an all-time high at this point, but our hospitalizations are a little higher than last winter. So it's the proportion of people who are being hospitalized is actually lower, which is a great sign. But given Omicron's transmissibility and the absolute number of people who are being hospitalized and the reduced staff of our hospitals across not only clinical staff, but all of those other critical staff that are needed to run a hospital, hospitals are really having a hard time right now. The vaccination status, your health history, and your age continue to be the largest predictors of who ends up hospitalized or needing higher level care. And in the state, it is important to note that the state is in the process of redefining what a COVID-19 hospitalization is, and that data is being collected right now and should be released in the next week or so. So we'll be able to look a little bit, have a better understanding of who's in the hospital because they're like having a COVID reaction right now, or they are in there for something else that they're also COVID positive. So that incidental COVID. And I think it's really important to remember that in times of a surge, you're more likely to find incidental COVID because more people are just going to be exposed or infected, but not yet know it. So, or still need hospital care even though they do know it. So I would not be surprised if there's a large number of incidental COVID in the hospital because we're in the middle of a surge right now. And if you go to the next slide, no matter why you were in the hospital, our hospitals need a bed to care for you. And at this point in time, 94% of medical and surgical beds are occupied. 87% of ICU beds are occupied. I've actually seen this number go to zero, like 100% on certain days for certain hospitals. It is like the school's touch and go for staffing, the hospital's touch and go for beds. So they're really struggling right now. Elective surgeries have been suspended. The National Guard has been deployed to assist hospital staff. They're recruiting non-National Guard people to help hospitals keep going. So we're at a critical point for our hospitals' capacity and function right now. And there are some regions in Mass, including our own, where there's like nothing left in our hospitals. So remember that these hospitalizations are a lagging indicator and they typically begin to decline 2 to 3 weeks after cases begin to decline. So even if cases began to decline today, hospitals wouldn't really see the impact until the beginning of February. So doing what we can right now to just try to minimize spread, especially to people who are more likely to be hospitalized, is critical. All right, the next slide is the deaths. So here are the confirmed COVID deaths in Massachusetts. We're averaging about 45 people a day, which has been trending higher since Thanksgiving, but is nowhere near as high as it was last year or in the first surge back in spring of 2020, which is great. And for a recent CDC publication, death among people who are fully vaccinated is really rare. It's 0.003%. We go to the Littleton data, 2 slides. This last week on the January 6th report we had for the period of the 2 weeks leading up to January 1st, there were 166 cases reported in Littleton, which was a doubling over the prior week. And this week, which the data ended on January 8th, so this goes from Christmas to January 8th, there was 293 cases, so another near doubling this last reporting period. So 2 more slides. So this is the average daily incidence rate for 100,000. These are where we've since I started presenting here, we're trying to compare the areas that are around Littleton. So we convert this to be a per 100,000 metric so that we can do this comparison. So Littleton's average daily incidence rate is 214.5 per 100,000, which is, again, like I said in the last slide, a doubling compared to last week's report. But all other areas around us are trending in the same trajectory. So everything's going up in a doubling rapid pace. Then on the right is the test positivity for our town and also for all the areas that we've been tracking. Littleton actually had a higher number of tests conducted this week, but our test positivity also increased. So we 18.5%, which is also higher. So again, like I just tried to explain at the beginning of the presentation, this is representing that we are not counting, we're not capturing all of the cases that are in our town in this data. But our 293 is an undercount for this period. And I did talk to Lynn over the break and confirmed that any of those at-home rapid antigen tests that are being conducted are being captured in the school data. So again, like the school data is getting incorporated into the town data. So we know that source is an accurate place, which is great.
When they're reported.
When they're, yes. If families are reporting them, they will get into the data. So if you have a student, please, or a staff member, whatever, please report the data. All right, so the next one is your Littleton school system cases over the last 6 weeks. So these are based on the health notification letters and the dashboard. The last time I was here, we had that 11. So the week leading up to December break, we had 19 cases. The week of December break was 48 cases, and then last week was the 83 cases. And so far this week, up to today, we have 85 cases with one more day in our reporting period. So what I am happy about is that we are sitting with one more day in our reporting period, and we have a same number of cases as last week. So it won't be, hopefully, a doubling. If there's a doubling, we've got something that went terribly wrong tomorrow. But all schools, and it's importantly that all the cases are actually pretty reasonably even across all of the schools, and that also reflects the community spread as a whole. Like the rate in the school does not seem to be different than the rate in the community, and it's across all age groups. So we're not seeing that one school is having an issue that others are not having. So we go to the next slide. This is the vaccination coverage for Littleton. The proportion of fully vaccinated residents of all ages continues to increase, and at this point we're at 85.5%. And this keeps just ticking up every week as those 5 to 11-year-olds come get their second shots. And also we have another 9% who are partially vaccinated and another 5% who have not yet started vaccination. So keep in mind that includes the 0 to 4-year-olds who are not yet eligible for vaccination. Our 5 to 11-year-olds became eligible for vaccine at the beginning of November. And at this point, 2 months later, there are 71% are fully vaccinated with another 16% who are partially vaccinated and getting there, which again, continues to blow my mind that every age group in Littleton is rocking vaccination.
It's incredible.
It's incredible. It's such a wonderful thing. And part of it is bringing clinics to town to make it easy for people to find it. Another part, there's just been a really good community support of vaccinations, which is great. And so from what I look here, our Russell Street and Shaker Lane kids will be getting closer and closer to that 80% threshold that Dusty said, hopefully in the next month. All right, so the next slide is new data. The state finally released some data on boosters. Boosters are important with Omicron, like boosted people who have better outcomes, less severe disease, definitely are able to have less severe outcomes with Omicron. So having a booster is really important. And approximately 84% of Littleton's fully vaccinated population are now eligible for boosters. And 67% of these eligible residents have already been boosted. The 12 to 15-year-olds just became eligible a week ago, and already 69 residents in this age group have received their booster, many at the clinic on Monday. And to date, there have been 226 16 to 19-year-olds who have been boosted. So again, about 54% of the vaccinated population in your high school have already gotten their third dose. Right. The next one, I'm entering that public health messaging piece, trying to help people make sense of things. The first thing is who is eligible to get vaccines and boosters. If you're 18 and older and it's been 5 months since your second dose of Pfizer or Moderna, you are eligible for your booster and you can choose any of the 3. If you had J&J 2 months ago, you should be getting a booster. J&J is really not holding up well against Omicron, so try to get your booster if you had yours 2 months ago. If your child is still the 17-year-olds and it's been 5 months since their second dose of Pfizer, they're eligible for a Pfizer booster. And then children 5 to 11 are eligible for their 2-dose initial series. And then 0 to 4-year-olds have not, do not yet have a vaccine. So they hopefully will be sometime spring this year. And then over the break, the CDC changed the quarantine and isolation guidelines for people with COVID-19 infections. The state has adopted these. So this is the quarantine one. So if you are exposed to somebody with COVID-19, what you do depends on your vaccination booster status. So if you're 18 and older and have received all the recommended vaccine doses, which includes your booster, then you can wear your mask for 10 days and keep an eye out for symptoms and try to test on day 5. If you have just received your initial series, then there's some other pathways. So hopefully everyone can screenshot this so they know what to do, but this is actually available on the main CDC website. They made this flow chart. I do want to point out that children aged 5 to 17, if they've completed just the primary series, also get to follow that, and all of the DESI guidelines have not changed. So this is like really your kids are on a different level than we as adults are at this point. And if you are not fully vaccinated, then you're supposed to be quarantining at home for 5 days and then continuing to wear your mask around others for an additional 5 days and testing on day 5 if possible. And if you go to the next slide, this is the one that I think everyone's cheering and also has some concerns. So this is, if you test positive for COVID-19, regardless of whether you're vaccinated or not, you are a case of COVID. And you need to isolate at home for 5 days, minimum of 5 days. You should stay in isolation if you still have a fever that has not resolved for at least 24 hours without fever-reducing medication. And your symptoms should be hopefully going away before you exit isolation. And the concerning piece is that some 30 to 40% of people will still be infectious on day 5. So with Omicron, those symptoms are coming early and people aren't testing positive right away. But the first day 0 is the first day your symptoms appear. So I've seen multiple situations, like people in town being like, what's going on? I have had a fever since this day, but I finally tested positive 3 days later. So that's day 3 now. And then, so day 5, they technically can come out of isolation, but they're still lighting up a rapid test that will tell us they're infectious. So, that's concerning.
Is it day 5 or the day after day 5? Day 6?
Day 6 is when you can return to public. Thank you. That's a good clarification. So, that is one of the reasons is wearing your mask, strict mask wearing for the 5 days after your isolation period is critical at this point in time, because you could still be infectious, and this will help limit the number of viruses spread into the air. The other thing is if you have those rapid tests and are willing to, it's not required, but if you're able to and willing to take a rapid test before you enter a public place on day 6, and if it's still positive, stay home another day or 2 and then test again. Again, not required, but that helps you know if I'm still infectious right now, I shouldn't be going to school where I'm going to be sitting maskless at lunch. I shouldn't be going to my office, spreading to my coworkers. There's still a chance you could spread COVID after isolation under this scenario. So this is where taking care really matters, and you have to be a little careful.
Are you saying that as long as you're testing positive, you're potentially contagious, even if it's like weeks later? Because I know many people test positive weeks and weeks after they
Thank you for asking that question, because that's a point of clarification. So only use the rapid antigen test, those at-home tests, to do this. Do not get a PCR. You will remain positive on a PCR for weeks. That is not the right test for to see if you're infectious right now. Rapid antigen tests don't have that amplification process in them. So they are measuring the amount of virus you have right on their swab. And so if you are positive on one of those rapid antigen tests, you are at a level that's infectious. Got it. But do not use a PCR at that point. That is not the right tool for this question. That's a really good point. And that's why they don't do pool testing for that one, for the PCR piece. But yeah, so it's a rapid antigen test that we will use at this point in time. Just those Binax Nows, the over-the-counter kind. And I know that the nurses have been really great for people who are like, my child's still lighting up its test. What do we do working with them about when they can return? So that's great. I think I hit all my comments on that one. And then the last one is the Mass Notify on your smartphone is another tool that we have at our disposal. So what this does is anonymously exchanges these Bluetooth codes basically with anyone that your phone has been around in the right distance for the right amount of time. And so if you report, you can just turn it on right under your settings, and if you turn it on, your phone will start just sharing these codes with each other that then they remember for only 14 days and then they go away. And so what happens if somebody reports that they're a case, then all of the case, every person they've been exposed to in that 14-day period gets a message saying you've been exposed and this is what you should do. This was on this date, this is what you should do. So this just is another way to know. So hard right now, COVID is everywhere, to just say, have I been exposed? The symptom that I'm having, is it in relation to a time? It's just another tool in our toolbox to help try to eliminate, or just to give us information about what our exposure and infection risk is and risk of passing on COVID.
Has this been promoted in town?
Yes, we keep talking about it at Florida Health, and I've sent it around to the administration multiple times.
But I'm still finding that a lot of people don't know about mass notify.
I agree with you. I'm not entirely sure how to get out. I've actually shared it multiple times on Facebook and everything. But again, I think this is a definitely underutilized tool. The models based on this, though, are that you don't need everyone to make it be functional. You need 10% of people to be using it for it to make a difference in our case. So it might be, it's one of those things that if you don't think, in a situation like a school where kids are mixing and they have their phones, at least the high schoolers have their phones on them. I don't think Jason wants to let his middle schoolers have their phones on them, to be honest. But
I'm sure he does.
I'm sure he doesn't too. Having a middle schooler. But like in those in-between times when they're, when they're on the bus, when they're at a sporting event, when they're at a concert, when they're just hanging with their friends, these are the other times that's kind of helping you do contact tracing that doesn't otherwise get happen. So if more people opt into it and use it, then the more, I know people who have gotten messages from these and then figured out, oh, I need to do these things, and then we're a case. So like another case got pulled out kind of thing. Not perfect, not the only tool, it is a tool.
Is this something that we could promote within our schools? I know we heard from a resident suggesting we do. I don't know if like in the flex block or in the high school, or just an announcement, administration.
Yeah, I'm actually meeting with the middle school and high school nurses next week in the administration, and talking about the possibility of doing it. I want to know the pros and cons of doing it to their internal operations. I mean, on the surface, it seems like a great thing. It's another mitigation strategy. It really isn't going to add any work to us. Best scenario is we may catch a close contact prior to us knowing. So we didn't have that conversation. If they're comfortable with it, I'll most likely send a letter out next week to the community. But again, you have to remember, and I've never been able to get the percentage in this community, but typically within a community, 25% of the population has children in schools. So you're missing most of your community when I send communication out. So, there hopefully is another entity, the town, or there's some entity out there that they can pirate my letter if I send one out. It doesn't matter to me. But I think if we're going to use this, we need to get some buy-in from our community. And it doesn't hurt. I mean, we're in a surge. If we weren't in a surge, I'd probably feel differently about this. But right now,
I think that's part of the reason it hasn't been a used tool widely until this point. has been around for months, but people haven't been using it.
Thank you for.
But I do think, I agree, I'm not sure how, there are probably other groups in town that would benefit from this as well. But if you reach 25% of school children, you're also reaching their parents who they can also turn theirs on, and then it just, you're reaching a good part of the household in town.
Well, maybe they'll advertise themselves as well. So,
And you can report rapid tests that you do at home via this app. So that is another good thing. You don't have to have the official test to report. And then otherwise, we're landing on cheese again, which is my last slide, but we don't need to go through that one. So just everything we're doing right now, the more things you can, more barriers you put up, the less, the more COVID has to jump through to get to you and others. So just keep using those cheese, layers of cheese right now. And that's it.
Yeah, thanks, Katrina. Just a quick question on the mass notify. So I signed up, I was mass notified last week. I was like, looked at my phone, this is interesting. Vaccinated, boosted, asymptomatic. Like, put the phone, like nothing changed for me.
Yeah,
Nothing
it's just
was-
telling you you're exposed, not that you're going to take it.
No, I understand that. So my point is, like 61, 63% of the town is boosted. Nothing would change for them. It's essentially a reminder that you need to be doing a daily symptomatic check of yourself. That's really,
Yeah, it's just.
that's kind of what it is at this point in time. And if we're all doing that anyways, that's kind of my impression of it. I had another question on the, at one point in your presentation, you had a figure that was like 0.0 something death rate. And was that among vaccinated or boosted?
Vaccinated. I think it's among vaccinated. Absolutely.
And my question is that mass DPH data or is that coming off of CDC?
CDC.
Okay, so
it's
it's mass, it's not
nationwide.
breaking that down. Okay. Okay, thanks. Thank you.
And obviously, this is something we're gonna monitor going forward. You'll read the news and everyone's making predictions. Is Omicron peaking? Is we gonna see a steep decline? But I guess we're gonna actually have to wait and see what happens. I think probably 2 weeks from now we'll have a better idea.
Yeah, I did see that the BioBot for the sewage rate was coming down rapidly.
Yeah.
And I was like, everyone's cheering. And I remember last year it was doing the same thing and the colleges came back and it went right back up for a while. So it is a positive sign for sure. It's still very high compared to where we were at any other point. But it's a good thing that it's been coming down and I hope that continues.
A lot of colleges aren't going back till February.
Oh, really? Even
I know a lot of
locally?
the state schools are kind of, we're remote for 2 weeks, same state.
Oh, I didn't realize. that.
Framingham State, I think it's the same way.
I think a lot of Massachusetts colleges.
Yeah.
I know both my girls went back,
Yeah, I know a lot of people are going back.
but that's Vermont and New Hampshire, so.
So it'll be staggered.
They'll be staggered. And the nice thing about the colleges is they've got the vaccination, the weekly, their vaccination mandates largely, the weekly testing. Like there's a lot of things happening that they have successfully used all fall and hopefully will help continue to help them for the beginning of the semester when it's supposed to be pretty bad.
What percent of the population would you guess at this point has had COVID?
I can tell you if it needs. I did not burn that number in my brain.
is that what Omicron?
You got an over under?
I'm guessing.
I would guess like 40%.
40? No.
About 25.
Is it really? I feel like,
I don't, I'm just guessing.
I don't know, I work in a school and I.
14%.
14%? Wow, I'm way off.
14% confirmed.
You're really hopeful.
Well, no, I think it's because I work in a school and like literally half the people I work with have had COVID. So I may have a skewed idea because I think it's easier, like, especially Omicron being
Oh, yeah.
spread. You know, we're seeing the vaccinated, boosted people get it. Truth be told, I had COVID over break and I had very mild symptoms because I was vaccinated, boosted, but you know, we are still seeing other people who are not fully boosted that having the same experience. So just from my own experience, like I said, it boosted, definitely helped me, because 2 years ago, I probably would have been in school with this ahead, because they were so minor. But I did test positive, and so.
Yeah, I've definitely heard the range of experiences, like you just described, that it was like a head cold to people on day 9 still having major fevers and struggling with fatigue and breathlessness. And that's for all ages. It's the range is amazing for who's suffering more and who's actually having pretty easy go with it. So.
But I do think that with Omicron, we're probably seeing a lot less reporting, so that number might not be 40% like I did.
100%. Yeah, these are just
it'll be higher than
confirmed
14%.
cases. Yes. And we know that. I could probably model it, but not going to do that right now.
That's not catching any asymptomatic case that wasn't associated with a test.
Right.
So to your point, there could be 25% of the population. Right? I know that sounds like a lot, but that's how you get to 40. So who knows?
Well, you
That's the
know,
takeaway.
with our vaccination plus our infections, we are continuing to add some knowledge of our immune systems are starting to build up some
So if
defenses against
fully vaccinated, boosted, and I've had COVID, am I like bionic now, or?
bionic. Yeah. I do, like, every time your body sees the vaccine or a virus, even a mild virus that you might clear and not ever have symptoms from, your body's learning from it. It's like rereading a book and picking up another detail the second time you read it, the third time you read it. So our immune systems are really smart in how they learn something new every time and then mature and get even stronger. So this is, I'm very grateful this is mild for most people, most individuals, because this is probably helpful to our immune systems for something that's still novel. If you think the flu, like that's 100 years to get to this point of, and our entire lives we've been building this immune knowledge, if you will, but we get this novel respiratory and spread infection, and we're only at the beginning of what we're going to learn from it as an individual.
Stella, what are your thoughts on mask notifying as a student?
I personally hadn't heard of the program before, which is interesting, because it seems
Talk to your parents.
well, it seems that there's been an effort to spread information around, but as far as I know, it hasn't reached the students or my peers, which is interesting. But I'm not against it. I think it's a very useful resource for us to have, especially as so many of us have our phones around anyway. It's just another medication that I think could be really useful.
Great, thank you, appreciate that. So if you're interested in Mass Notify, you can go under notifications in your phone, scroll and find it. And if you can't find it, just Google it and you can sign up within 3 minutes. It doesn't take long enough. So thanks, Stella, appreciate it.
Next we have Lynn Snow, is going to give a presentation on school metrics.
Another COVID-19 health and safety protocol update. I was just looking at some of our numbers and I thought it might be interesting to share. I was just looking at our testing dashboard. Our nurses have performed 1,635 point of care tests since the start of the school year. We have 3,553 total negative test results, which is impressive. As of 1/7, we have 250 total positives. Just this week, we have collected 167 pools. And the week prior, 163. So we're still continuing to do a lot of testing, and it's definitely helping us through this surge. So the first thing that I wanted to do is just go through the DESI protocols for responding to COVID-19 scenarios. They did provide some updates on December 30th. The first one is that DESI and DPH continue to strongly recommend that all faculty, staff, and eligible students continue to receive the COVID-19 vaccine, and they've added and the booster. At this time, Fully vaccinated continues to be defined as 2 weeks following the completion of the Pfizer or Moderna series or 2 weeks following a single dose of Johnson & Johnson's Janssen vaccine. Following the 5-day isolation period, individuals must mask for an additional 5 days when they are around others. And the following addition is that for all exposed, they did include a statement that says best practice would also include an antigen or PCR test for COVID-19 at day 5 after exposure. An antigen test may be self-administered and does not need to be proctored or performed by a healthcare professional. Another interesting note, if you've seen it in the news, is that the rapid tests are going to now be covered by health insurance, which is going to be helpful. So the next change is to Protocol C. So Protocol C is the protocol that applies to vaccinated and non-vaccinated individuals who experience COVID-19 symptoms listed in the first section, applicable to their status and who have not tested positive for COVID-19. So you return to school post symptoms with tests. And so the change here is that you have received a negative PCR they've added or antigen test result for COVID-19. An antigen test may be self-administered and does not need to be proctored or performed by a healthcare professional. One of the things that we need to make sure that we are aware of, although they have made this change, there's an important note that is explaining that Binex Now tests are less sensitive and less specific than PCR tests. PCR confirmation is recommended for asymptomatic persons with a positive Binex Now test and for symptomatic persons with a negative test, unless those symptoms are unlikely to be due to COVID-19. If the results are discordant, for the purposes of the protocols, the PCR result will be taken as the true result, assuming that the 2 tests are done within 2 days of each other. So that's something that wasn't included specifically in that protocol, but it's related to this. So I thought it was important to know. Okay. The next change is one that Katrina already spoke about. The duration of isolation is at least 5 days from symptom onset. Return to school after 5 days, returning on day 6, assuming they have improvement in symptoms and have been without fever for at least 24 hours without the use of fever-reducing medication. One note that I'll say here is that with Omicron, scratchy throat and fatigue are 2 pretty prevalent symptoms. So we really want to make sure that when you are returning, you're symptom-free and taking those symptoms into consideration.
So the day 6 antigen test is suggested and not required.
Correct.
That's correct.
Yep. And so then there was just a couple FAQs that they shared. Vaccinated close contacts be included in test and stay. No, this has not changed. Vaccinated close contacts are exempt from testing and quarantine protocols. Is test and stay still only for in-school close contacts? Again, yes, this also has not changed. And then again, they just re-emphasized that fully vaccinated is still defined as 2 weeks following the completion of the Pfizer or Moderna series or 2 weeks following a single dose of Johnson & Johnson Janssen vaccine. And then I just wanted to give a quick update on the safety check program participation rates. I had last time we did the update, I had I think it was the end of the last school year, and then I did November and January. I didn't have time to do the percentages before I had to turn in my slides, but I do have them. So for right now, Shaker Lane, their participation in November was 67%. They're now at 79.7%.
Are we defining participation as people are actually taking the test?
Are actually consented.
Consented?
So, yep.
Okay.
So some of the increase is attributed to parents that are consenting because their child has been defined as a close contact. So they're wanting to do test and stay at the moment, or their child's symptomatic and they want to be able to be administered rapid. So that is taking into account some of this increase, but it's still nice to see. And given the size of our pools, a lot of people are participating. We had great participation following break. Russell Street was 74%, and now they're at 83.3%. The middle school in November was at 58%, and now at 70%. And the high school was in November at 57%, and they're now at 65%.
Total district, with my calculation, would be around 74%.
Thank you, because I did not calculate.
More than happy to help.
Close contacts. So the protocol for asymptomatic close contacts who are not exempt from testing and quarantine response protocols and who have consented to participate in the district's safety check program. Test and stay, the B1 protocol option to minimize the amount of time that individuals are out of school. The testing and quarantine response protocol has been shown to be generally equivalent to quarantine for school-based contacts and a safe alternative to at-home isolation. Individuals who are part of the test and stay protocols may be eligible to participate in school sports and extracurricular activities provided that they are in compliance with the applicable protocol. For events and sports that take place on non-school days, testing will still be required on those days to participate, and as part of test and stay, quarantine is still strongly recommended for individuals outside of school.
And that testing would be just an at-home family administered. If it's,
Or we can provide an EMED test.
Okay.
Mhm. If they're participating in the test and stay, but the way it's been happening, a lot of the sports are during the week. I'm finding we haven't had to distribute any EMED tests to this point. But the test and stay duration has been amended from 7 days from the date of exposure to 5 days from the date of exposure. Close contacts can remain in school and do not have to quarantine so long as they are asymptomatic, wear masks in school at all times other than while eating or drinking. When these individuals cannot be masked, for example, when they're eating or drinking, they should maintain at least 3 feet of distance from other individuals to the extent feasible. Take a rapid antigen test on each school day and receive a negative result. When the 5 days from the date of exposure includes weekends or holidays, individuals should quarantine on weekends, and if they remain asymptomatic upon return to school, to be tested immediately. If the individual remains negative, they can stay in school. The traditional protocol, if the family or adult individual chooses to not participate in test and stay, the duration of the quarantine is at least 5 days from the date of exposure. They return to school after 5 days, returning on day 6, provided that they remain asymptomatic and conduct the active monitoring for symptoms through day 10, self-isolate if symptoms develop, and adhere to strict mask use for an additional 5 days. If an individual tests positive at any time, they do follow the protocol for individuals who test positive for COVID. And then just a procedural update about contact tracing. The contact tracing, if you don't contact trace, you don't know how time consuming it is, but it is an extraordinarily time consuming task. And the nurses have been doing such an amazing job at it. But just as anecdotally, we had 200 close contacts the week we came back from school. So that means 200 letters, 200 phone calls, 3 different categories of letters were going out, phone calls, return phone calls, and then guidance and discussion with each one of those 200 because it's different protocols for each. So right now, because there have been changes, we've implemented the following procedure. For elementary, you will receive a notification to the whole classroom in the event that there's a positive case in the classroom, middle and high school. So there'll be notification to all members of the individual classes. So we'll be sending out a grade level letter, and the nurses will be directly contacting anyone who needs to quarantine or participate in test and stay, because that's really the important part.
Can I ask a question?
Sure.
So, because when I got this update, I was a little bit perplexed. Why are we in fact notifying an entire class if there's a case? Like let's use the high school as an example. And let's say that 85% of the people in the classroom are fully vaccinated. So they're exempt from doing anything. What's the point of notifying everyone that there was a case?
So that they have the information and parents are able to make the decision, because some parents may be like not meaningful and they're not going to act differently. But if another parent may say, okay, I'm going to be more mindful of the way that I'm interacting this week, my child was potentially exposed to COVID. So they may not bring their child to, great grandma's that, Wednesday night or something.
And there's still close contact. We're still following the CDC guidelines.
Right.
Less than 6 feet. So
So they weren't necessarily a close contact because we're notifying the whole class. there's a separate letter that's going out to close contacts.
No, they're just being contacted directly if they have to participate in test and stay, or if they have to quarantine because they're opting out of test, they're not opting to participate in test and stay.
Okay. It just took me a little bit by surprise because last meeting we talked about, hey, we're getting all these letters and people are kind of like, what is this meaningful anymore? There's so many cases. And then the change was back to actually more information to people. And it just seemed kind of opposite of
The intention of this is to lessen the burden on the nurses, truly.
and I'm okay with that.
So,
Like, if that's what this is accomplishing, fine.
it is.
Yeah.
Because if I can just give a little scenario of contact tracing, what a nurse has to do, once they have a positive, they then have to reach out to the teacher. And the teacher needs to, during the infectious period, not only look at their seating chart, but did they go off their seating chart? Did they do any special groups? Were there any times where they were doing a cooperative project? So then they have to contact trace for that, because were they within a certain distance or not? So it truly became an insurmountable task. I mean, it took Herculean efforts before, but when you have 55 close contacts for one student, it's a significant amount. And Omicron is so infectious, and when we know that a lot of the contacts are happening outside of school, there's really no negative to informing people that there is a potential exposure.
So at the high school, you're going to be notifying whom?
The grade level.
So, but I know that my daughter, I know that this is still in with but he does have the superlatives, what do they call them now? I'm dating myself. They're extra, like I know my son takes a computer class.
Like an
It's with an elective. Thank you. That is with upperclassmen.
Mhm.
So if there was a junior that got COVID and you're only informing the junior class.
All the impacted members.
It's a classroom, not the
Right,
entire
right.
grade.
John can also weigh in here.
Okay, yeah.
That's what it says. Classroom.
Yeah, come on up, because
But
we had a lot of
a classroom in the
conversations.
high school, a classroom in the high school, a kid is not in the.
No,
It said
we
all
don't.
classes.
Someone's right, there are mixed classes, there's a lot of them. So we are going, so what we'll do is we'll get together, clarify exactly, give you an update at the next meeting, exactly what we're doing. We discussed this as an internal team at the high school and the school nurse. This the last couple of days, we've been involved in conversations. We actually have some clarification about what we'd like to specifically at the high school that fits our needs. It actually makes it a little bit more of a burden to actually notify six different classes. One of the scenarios we came up with to clarify is you could have Stella could be sitting right next to, another student, but there's another student that's in the last row of the class, way more than 6 feet away, and never comes into contact with that student. So our current protocol, current practice is working. It's a little cumbersome, but we actually found that to notify an entire class would be a little bit more burdensome. This line was created before this adjustment just yesterday. So we'll update you with what we're doing at the high
I was just
school.
wondering how.
But I wanted to clarify
I know,
that
like,
too.
at
Thank
Russell
you.
Street and Sugar Lane, you can notify a
Very
second grade
easy,
class
yes. The
very
middle-
easily.
The middle and
Yeah.
high
The middle and high
school
school.
is
It's a
very,
different-
very
different
different.
Because when they're in their UAs, they're with all different grade
Yeah.
levels. Okay.
And so what we did was, Chris and John went through a potential scenario. And then, like, looking at it this way, like, wow, if a student takes
Just
5
yesterday.
classes and an
Yeah.
elective, that's gonna be, 155. So then we looked at, how do we do that in a way that is going to be lower response effort for the nurses, but also taking into account the majority of the students are vaccinated at the high school. So the ones that the nurses really have to do anything logistically with is a very small number of
Right,
students.
those that are unvaccinated. that
Correct.
Could get close contacts. Okay.
And
Thank
this is a change because we have a spike in COVID in our district. We'll reevaluate it when it's done. And it's not just to decrease the amount of time nurses are contact tracing, it's also to notify the parents in a quicker time period. So that we can create the intervention that's necessary rather than having the nurses running around for 5, 6 hours doing extraneous work when it's really not necessary, especially with the numbers we have. I mean, folks, the landscape's going to change. So what's good today may not be good in 2 weeks. I mean, you all know that as soon as the Omicron virus subsides, I intend to stop sending my letters out because we developed a webpage. Every time I send one letter out today, there's a link to the webpage. So, you know, we're going to get to that point, but now's not the time. And when we get to that section of the agenda, I see, maybe I'm wrong, this speculation is a tough business, but in March, things are going to look very different in terms of what we do.
Lynn, can I ask you a question? Can you mind going back to the FAQs page, just a couple of slides back? So the first FAQ, can vaccinated close contacts be included in test and stay? The answer is no. I got questions from a couple of parents about 2 classes, I believe both in Russell Street this week, where the entire class was considered a close contact.
Right.
And parents were given 2 options for every student in that class. They could opt to put their kid in test and stay and have them test and stay, or keep their child home for 5 days.
That's a good question. I should have noted
Yeah,
that because
what's
the
going on?
Board of Health supersedes. So so there was a number of cases in, I think it was 2 classes. And so when we have a situation like that, we have to seek out guidance from either the Decibel Detect hotline and the Board of Health. And then they provide us with guidance. And so that was good guidance.
The Littleton Board of Health?
Mhm.
So the Littleton Board of Health said, let's
No,
supersede.
let's back up. It's the nurses and administration. For the Schcmte boards of health, not the board, not the elected board.
Not the Littleton Board.
No.
No, the
it's
SHOBA, I'm sorry.
The
I don't know
SHOBA,
the difference between them.
Association of Health.
Yes.
So they want
Staff.
vaccinated, asymptomatic kids who are in the classroom, who may or may not have been close contacts, but those kids must test and stay or be.
Not much. I don't know. They
They
gave
can
us,
be kept, or be kept home for 5 days.
they gave us the recommendation and that the parents were communicated with.
That was a DESI recommendation, the COVID hotline. And it's part of the process that you need to go through before you get to the point where you request that a class be quarantined and go remote. So it's a tiered system of decision making. So when we get in that situation, they're telling us what they think we should do. And it's really a protocol, because if we don't do it and we get to the point where we need to quarantine the whole class and go remote, they're going to make us go back to the step that we didn't do. So we're in this situation where, and hopefully it's not going to happen that often, but when we're not sure about infection within a classroom, we need experts to help us through it.
And that could have been the alternative. So the alternative is that they would have told us that we needed to close that class temporarily. So this was a way, I believe, for us to be able to see who in that class potentially had COVID and had active, because there's so many breakthrough cases too. A significant number of cases are breakthrough cases of individuals who are vaccinated. I think it also took into consideration the fact that there are many students in grades 3 to 5 that are in the process of being vaccinated too. And so they may not be fully, or they may have just gotten to full vaccination.
Okay, I think some parents that reached out to me were very confused about that, because it's actually what's happening with those kids that are vaccinated asymptomatic, but being required to either test and stay or quarantine is the opposite of what the protocol is. It's not the current protocol. So we went against the protocol.
We didn't go against the protocol. So the protocol gives us global guidance. And so within that, there are many, they can't control for every different scenario, which is why there's a DESI hotline, because there are unique and typical scenarios where you have a significant number of cases in one specific area or classroom or within an activity.
Okay, and a related question, not about those classes, but generally, it's great that the numbers are so high, up, the percentages in test and stay, but also the vaccination rates are so high in those schools too. So why are there so many kids who are vaccinated and so many kids who are in test and stay if vaccinated kids shouldn't be testing and staying?
That's the pool testing that they're opting into.
They're opted
They're
into both
consenting into
pool
everything,
testing and test and stay.
and therefore,
So the vaccinated kids are still being tested.
if you
No,
want,
if they want to, they don't have to.
But like
It's not.
70-80% are enrolled.
A lot of them are, because we have a lot of breakthrough cases.
Right.
In the state, in our school district. And they don't have to test and stay. I mean, if they're asymptomatic, they're fine, with the exception
With the
of
exception
when
of
we
those
have
classes.
issues in a classroom, where we're trying to figure out whether we have a cluster or not, and what's the next step, and before we we request that we go remote. Hopefully we won't have to do that, but you know, they're helpful because they have the experts in this situation. I mean, when we get to that stage, I'll be quite honest with you. I want the best in the state. I'm not going to settle for second best. I want the best people I can get giving this advice so that we keep people as safe as possible. So that's what we did.
And another example is, a couple months ago when we looked at our high school cases, I think, when we drilled it down, half of them were breakthrough cases.
Yeah, I just wanted to add with the two classes that we had this week, the testing stage worked beautifully. And the Board of Health was really appreciative of our efforts to go forward with that. There's so many, as we indicated, there's so many kids that are already signed up for pool testing that there was only a handful of kids, that families who had to make a decision on whether or not to sign up then, and everyone did. So the whole class comes down, they all do it, they wait and they read books for 15 minutes, they go back to class. So we know that everyone, everyone's negative at that point, they go back up to class. And we have the system down. Members from the CIC were there to help as well. Andrea and I went down the tables when it's all done and everyone goes back. It's a matter of 15, 20 minutes in the morning. So
And is that going to be a
really
5-day protocol?
So they'll go, yep. So
they'll
for
end
those
up
two
with
classes, Tuesday of next week is their last day.
I'd like to go back a bit. 3 months ago, every school committee we talked about the necessity of getting full testing numbers up, whether they were vaccinated or not. So that's what we've done. 74% is pretty good. So just want to make that point because we all knew that vaccinated people didn't have to take part in full testing, but the number of breakthrough cases that districts are experiencing, we endorsed that. We took the charge and we're being successful at doing it.
I also would like to add that pool testing, at least for me and among my peers, has been just a really great source of relief. Whether most of my peers, obviously, as we can tell by the numbers, are vaccinated. And even though, since we're vaccinated, many of us are boosted, we're most likely to be asymptomatic or have lessened symptoms of COVID-19.
Very good point.
It's still a point of relief to have the test and the negative, or the negative pool every week.
Yeah.
And I think that's just been very useful to have in schools, just as a mental thing, just as a.
Right, right. And we've maintained the second swab is a lot of work, but because it's PCR based, because it gives us that confirmation and because it does give every member of that pool that second individual test, it really is a great layer. So we've stuck with it.
And Omicron is, every variant is different, but this one's a little sneakier. I mean, our rapid tests are pretty accurate. We're finding with Omicron, it's challenging at times. We're getting negative tests for 2-3 tests, and then it'll test positive. We've had negative tests, and then the individual belonging to the pool testing program, and their PCR comes back positive. Well, it comes back positive because it's a more in-depth test. It'll pick it up far before a rapid test. So we're finding more of this happening with Omicron than we did Delta, the original COVID virus. So it's kind of interesting how it changes with the variant.
Omicron seems to be very different.
It is very different than the prior in multiple ways.
Yeah, no problem. I just wanted to sort of expand upon that classroom situation because I had folks reaching out to me as well. And I get it. Like, we want to make sure the school environment is safe as possible, but people's children they're vaccinated. Those that are eligible are boosted. They're wearing masks. They're feeling well. And it's like, now all of a sudden my kid has to test to stay. I think people got rubbed the wrong way a little bit by it, saying, I've done all the right things.
Right. Well, there's no logic to this virus, but I would also, I think it's great for parents to reach out, but when they have questions, we have a team of RNs and nurse practitioners who are also always available
But they also reach out to us as elected officials and community members to say, hey, look, was there a change that I missed within, school committee policy or anything like that? So, what's the number, like, in a classroom that sort of, we pick up the phone and we're contacting the Children's Board of Health for advice?
It's decimals.
Right.
5. Okay, and then
What's
we,
the classroom
did
size?
we-
I'm sorry, what was the classroom size?
Our classes are 22 to 25 in the class, and we had one class with 4 kids in it and one class with 5 kids in it. And that really was the initial question, is what is our tipping point?
Mhm.
When you think about the configuration of the classroom, and you just put 5 kids in there and then figure the kids that are sitting 3 feet around all those kids, it becomes impossible to contact trace, right? It's almost like everybody in that class was close to somebody, and that's why. And we did not run into that experience until this week. We hadn't had multiple cases in the class until this week.
Okay,
And considering the number of cases that we've had, I mean, I'm 2 classes out of, I used to calculate the number of classes we had, it's, somewhere well over 1,000. It's minimal, and so if we started to have to do that with 50 classes a day, it would be problematic. We'd be sitting here saying to ourselves, something needs to change, and we're not there. But I know it's frustrating for some parents. You can be assured that the letter went up to them and it was self-explanatory. And I know it's a deviation of a protocol, but you can't possibly think of every scenario when you're dealing with a virus or many other things in life. There's so many analogies that I could give you, and I'm going to refrain from doing that this evening. Do we want to do it? Of course we don't, but our job is to keep people as safe as possible. And that's what we're charged to do.
did we pick up additional cases?
When we tested, yeah.
So what was interesting this week was a lot of students came to school on Monday for the pool testing. And then when we had the positive pool information on Tuesday and we retested those pools, almost every case we were looking through, we didn't have any positives, but there was somebody absent on the list. We're like, oh, that's the student who came in to test yesterday. I personally am wondering, I think before the at-home tests were more available and people were able to get them and test at home, and now they've become less available. And so students are coming to school knowing they can get tested at school. So we did pick up from the pools. We were able to identify the positive students.
But from the 2, when we tested those 2 full classrooms, did we pick up additional positives?
One.
I'll put in a little small plug that the
So
rapid
given it-
antigen tests are available at the Walgreens on Plain Street and Lowell, and a shipment of Binax
5 minutes
now is
ago,
coming
but
in on
not.
Friday night.
I have to say, like, given an airborne exposure where you have 5 sitting in one class, the fact you've had 1 convert so far is pretty amazing. Like, there's a lot of layers in there that seem to be working.
Windows are cracked.
I given my kids
You're
in one of those
right.
classes, I will cross my fingers. But yeah, no, there's a lot of things happening that is minimizing that.
And one thing about Omicron, once it's in the air, it doesn't last forever. It's virulence phases out pretty quickly from the articles you may be reading some different articles, but the journals I've been reading are saying that Omicron is in terms of survival without being within a host is far less than Delta or the original coronavirus. We
Yeah,
concur?
Mayor.
All right.
Hopefully, cross your fingers up.
Thanks, Lenny.
Thanks, Liz.
I noticed Kevin Davis has had up for a while. Sure.
No.
Kevin Davis, please state your name, your street, and your question, please.
Hi, my name is Kevin Davis. I am at 35 Whitetail Way. And I have a couple of comments I'd like to make because as the National Test Director for Exposure Notification, with this great information and power comes some great responsibility to help educate our community. And the thing I want to do first is let you guys know there was a study out of Washington State that showed that as you increase the number of people that participate in exposure notification, the amount of contact tracing exposure, close contacts that show up also dramatically increase. So that's always a good thing. So with small numbers of increases can come larger reports of contact tracing. All my entire family has been participating in the exposure notification trials since the alpha phase when the state started doing this in February of 2021. So we've actually been participating a long time. And the first time we actually got an exposure notification was on my daughter's phone a while ago, last week. And it turned out that we actually knew about the exposure notification before the school nurse did. So we actually reached out to our school nurse and called them and let them know, and we started the process. So we were, instead of being reactive, we were being proactive and actually working with the school nurse to kind of come up with the correct approach. So that's something that can definitely help out the nurses identify additional close contacts. I am more than willing as a resource in the community to come help out the school to answer any and all of their questions, and also to brainstorm about approaches. And I'm more than willing to help out where I can and come in. Finally, for people that are interested in turning this on, it is available on iOS and Android. The iOS app, all you need to do is go into General and then scroll down a little bit and you'll see exposure notifications. And Dr. Clenchey was right, it takes about 2.5 minutes to go through and set it up. On the Android phone, it's a little more complicated. You have to go to Google Play and go look for exposure notification or the Mass Notify and Mass Notify app in Google Play, and it'll come up and it'll take you that same 2 to 3 minutes. It is completely privacy protecting, the technology. Katrina did a wonderful job explaining it. It doesn't share your location. So actually figuring out how many people participate in the town of Littleton is not possible. The state can know how many people actually participate as a whole in the state program, but because of the privacy protection, there's no way to know how many people within a certain geographic region are actually working. So with that, I'm done.
Thanks, Kevin. I just did it while you were talking.
Perfect. See? That's awesome.
All right. Appreciate the plug. And obviously, if we can have you come in and talk to people, that'd be great.
I will be more than happy to come in and help. That's part of my job.
All right. Thanks, Kevin. Thank you.
You're very welcome. Have a great evening.
All right. Next, we're gonna, Dr. Fetch will tell us a little bit, as many of you know, we postponed our LHS mass flexibility trial given the current circumstances with Omicron, what's going on, not just in Littleton, but throughout the country and the world. We thought the ideal time to implement it. And just Dr. Fetch will give an update on that.
Yeah, it's gonna be a real quick update because I did attend the Board of Health meeting last night and had an opportunity to talk with them. And we took a look at the conditions. We made 2 revisions to make it more palatable to us and to them. And they didn't say much, but I think what was powerful, what I took away anyway, is it was evident that they realized the landscape was going to change. With the advancement of treatments for COVID, that's another game changer in trying to make sure that if somebody catches COVID, they try to keep the symptoms as mild as they can. I mean, there are always going to be people that have more severe cases, but these treatments are another game changer. So they also use the word endemic in the meeting rather than a pandemic, which is very powerful when you think about that. So I'm not sure what's going to happen in the next 3 weeks, but I'm feeling pretty comfortable that we're going to see some positive changes in terms of our numbers. And with that, we may in fact see changes in the way that we deal with COVID in our communities and schools. We'll have to wait and see. So, all our hard work is paying off. And hopefully
There won't be another variant, but if there is, hopefully it's less virulent than Omicron and is less severe than the COVID variants that we've had in the past. I mean, who knows what way it's going to go? We're dealing with a subcellular particle here. I mean, it's pretty smart, subcellular though, and you have to remember that. So there's people that spend their time developing models in terms of what happened. In fact, I sent you an article from Northeastern today. And we have a series of models. It's like when we predict what kind of weather is going to come in a given day. So I just found, I was very pleased with the conversation that we had last night at the Board of Health meeting. And, especially when they all nodded when they were talking about the fact that this landscape is going to change. And hopefully not in 2 or 3 years, but hopefully by the beginning of, or before the end of the year. But we don't know that. I mean, nothing's certain, as we all know in this world. But from what we've seen with Omicron, New York, they're already on a downward decrease in cases, and that's a hopeful sign. We all know about UK and South Africa, and on and on. So it seems to go out as somewhat as quickly as it comes in, which is hopefully the way it goes. That's really all I have to say. I mean, we'll have to wait and see what happens, and I guess the mass flexibility trial is to be determined at some later date. We are on the agenda on February 7th meeting, I believe it is. And 9th, thank you. Have a conversation again. See where we're at.
Kelly, do we have to formally request the waiver again from them because they rescinded it essentially? Or is there, are we going to go through the motions to request it so they can discuss it in February?
Yeah, as long as they have a mass mandate, a townwide mass mandate in place, and they extend it until the end of February. We will have to do that, but they all acknowledged last night, they don't want this to be a cumbersome process. We've been working with them for a while, we've established a relationship, and we just really need to get together and see what the landscape is, and then develop any conditions that we may feel are necessary for a mass trial. What they are, and how many, we don't know. And we hope that there would be fewer conditions by the time we do our mass flexibility trial. We'll wait and see.
We have the conditions I'm looking at.
Right, but
we already have the conditions, right? So are we going to resubmit to them the same conditions?
of course, but I'm not sure that these conditions are going to be as plentiful when we do our mass flexibility trial if it's after the February break, for example. I would hope that there are less conditions on that page. And again, it's only speculation, but you know what? If there isn't, we already have something.
Right.
So we're in good shape. And I can't see us adding anymore because I think this is pretty conservative. So the only thing I would expect would be that, it would be the same, or maybe there would be two. That's what I think.
Thanks for attending the meeting last night, Kelly. I had a slightly different takeaway from the meeting. Essentially, the administration had reached out to the Board of Health in advance of the meeting to say, hey, look, we've got some criteria. The criteria doesn't allow for us to start. We'd like to let you know that we're not going to be starting January 18th. That was acknowledged at the meeting, and then they went one step further, which I believe was unnecessary, to say, well, since the motion contained a start date, we should fully rescind it, vote 5-0, we completely lost the mask waiver. Which I put a really bad taste in my mouth. Their meetings, it's not like they're meeting again next week or the weekend. They're not meeting again until January 9th. I really do think that if the other school committees or members are up for it, we should have a quick discussion about the conditions, possibly put a motion back on the table, ask for the waiver again on the 9th, and see where we are then. Like I said, we're not going to know where we are, but I feel like the can is continually getting kicked. And now it's kicked till January. We were supposed to start this December 6th. The data that we laid out would have worked based upon what we had seen. Now we're February 9th. It would be weeks after that. Maybe the time to start is March. But if we've got metrics that we like, we should get back on the agenda with the metrics and simply just eliminate a date,
Right. So
a start date. And the other point I wanted to ask Dr. Clenchey about was, you know, you had mentioned maybe it won't be as restrictive. I mean, have you thought about some things that you would like to amend? Is it the 11 or more cases, or?
No, at this point in time, I mean, the conditions are certainly what we need, the same conditions we needed pre-Omicron. And when Omicron subsides, I think those conditions are valid unless there are going to be some relaxing of expectations in terms of mitigation. So that's the unknown.
For clarity for those who are listening, just so we're not asking for the mask mandate, or sorry, the mask optional to be put into place next week or the following week. This waiver has I'm looking at it on my laptop. So it's very specific and plentiful conditions and restrictions on it. Proof of vaccination, parental consent under 18, 100% participation in pool testing. Very specific numbers around case numbers and multiples of case numbers every daily, weekly, et cetera. So if weekly case counts, rise a certain amount, masks go back on. There's a major caveat that says the Board of Health may at any time rescind the exemption should it determine there's this substantial public health risk. So just so folks listening in have some serious context, we're asking for this with many, many conditions put on it to start with. So there are a lot of safety measures and stopgaps built in here.
Appreciate you saying that, Jenny. And Justin, I guess my take was a little different. I was under the assumption that the February meeting, they would take a look at our conditions again and then see if the landscape had changed. So in terms of rescinding a motion, I've done it with this school committee a number of times since you've been on. If there are dates attached to a motion and we can't do it, you need to get it off the books. No, they could have said they could have created that motion. They chose not to, but that's their choice.
Is there a way to create an open-ended motion that will allow us to act without putting a date, a specific date, start date on it?
Sure.
So
Yeah.
It was kind of it's that situation where we tried to provide enough information that made them comfortable, and the information got in the way of us actually keeping, they had the option last night of continuing the hearing, and that's the direction it was going. And then it was brought to everyone's attention that there was a date, so therefore they can't. And I feel strongly that we should just formally revote this through so that it ends back up on their agenda and we can take a look at where we are.
yeah, I don't, at this time, I like I said, as far as the conditions, I still think are appropriate. Like I said, it may be that as we see a decline in Omicron, that we can look at that and say maybe there are a couple things that we should tweak here. But I'm all in favor of putting that forward so that we can move and be more flexible. So that we're not doing this every time they meet if the conditions, if the date's not right, so that we can just show some common sense and like, okay, we're gonna move on. Well, can't do it now, but let's revisit this next week or next time we meet and see if conditions are right to implement the mask flexibility.
As long as they have our conditions on their desk, they should be able to implement it when conditions are right.
So I would suggest a motion without dates. Brad, I'm sorry.
Well, I slightly different read than Justin did. He trained us about this. I thought it was understood as a bureaucratic move. They had a motion on the table that had this date to this date. They said that's no longer in effect, so we'll clear it off. I wasn't offended by that. I guess for me, I think we have a good plan. I think we have a good plan with triggers for putting the mask on once based on case counts in the schools. It was always my assumption that that would not be the only metric that we're looking at. We'd also be looking at broader community things as well. And that I think involves a conversation maybe more so than a blanket thing. So I support trying this. I would say, instead of just saying I don't know what the motion would be. The motion would be any time that we have fewer than 11 cases in a week, then the mask flexibility is allowed. Is that the motion?
Well, no,
you
would make a motion to continue to adopt the conditions.
Understood. But the one metric is, so that most of those criteria are for individuals who participate. They must be vaccinated, they must participate. But the one kind of system-wide or school-wide metric, if I recall correctly, I don't have it right in front of me, is that that there is a number for the school. Once that school, that one number is kind of the toggle on
You
off
wanna put
switch.
that up, please?
Um,
Let's just put it up so we
Yeah.
can see.
Sure.
That might be helpful.
And so I'm not entirely comfortable with just saying, hey, anytime, because I don't think that was the tenor of the conversation before. And maybe it was, and I misunderstood, that anytime we got to that one number, then it's deemed safe. That may be the most important number, that may be the number that we're all looking at most closely, but there may be other factors in play.
Rod, I think you're right. That was a number to sort of end the trial. And we are, in theory, using that as a number to allow to start the trial. I think what the assumption is that we're going to see cases continuing to go, start to go down and go down rapidly, similar to what we saw last winter. The Boston sewer discharge, the numbers are already indicating that could be a possibility. So, I don't want to complicate things and say there's got to be a trend analysis or like, I think we just say, hey, look, if the numbers work based upon this and the administration feels comfortable, I mean, it's Kelly's call, it's the leadership team's call, we support it. If they say now's the time to do it, we should have them, we've voted it through, the Board of Health voted it through.
Well, I guess that's where I think a little more, if the calendar lays out the way the calendar lays out, they're not meeting until February 9th. We have another meeting between now and then, at which point we will have a better sense of what's happening. So I would just say, we have a plan in our back pocket. There's nothing will happen between now and February 9th. Let's vote on our next meeting where we can have more, maybe data and or community. Maybe all this stuff is trending right. Saying absolutely, let's go.
But
I think a lot can happen between now and February 9th.
I honestly
It really
think what Justin is saying is more so, we know our plan. We know what we want done. But we have to wait on the Board of Health. So if we say to them, this is our plan, and when you believe that our numbers in town are okay, and our numbers at the school are okay to implement this, please do it quickly and expeditiously, like get it done so we can try our 3 weeks. So that it doesn't have to come back to us and then go back to them.
I agree with that. Unless they would be willing to call an emergency meeting before February 9th. That's, and I don't anticipate they are. Then the February 9th, I'm using that not as a predictor of what's happening in the community, or what's happening with sewage flows and stuff like that. But when that body will vote about giving us away from the mask mandate they passed last night to extend the town to February 28th. If there is no real likelihood of them approving anything for that meeting, then I would feel more comfortable voting this forward. In 2 weeks, we're going to meet again. I anticipate that all the metrics will move in the right direction. I anticipate that we'll probably hear from some people and get a little more community input, and that we can all do so with confidence. I expect this would pass again 5-0. But just at this moment, those numbers are still very high. And if we're looking, and I would like to consider the larger environment and not just the 11 greater than less than when voting as a school committee to support this or not.
Brad, just to add to the 11, and maybe I didn't explain it as well as I could have when we did this in a number of weeks, but the 11 number is really tied into the community because the numbers in the community mirror what we get.
Yeah, I'm aware.
It's just proportion.
Yeah.
So there is there's a check and balance built into the 11. But,
Well, we're using the 11 as a proxy of what's happening in the community, but we're not, according to this plan, actually looking at what's happening in the community. We're trusting the 11 to be an accurate representation. And so what I'm suggesting is, they're not going to vote till February 9th anyway. Let's just take the 2 weeks and see what's happening in the community and hope, and then I hope be able to act with greater confidence then. I don't think there's going to be any real effect on what happens in our schools because they're just not going to vote before then. But I'm one vote. I don't understand.
So if I understand you correctly, what you're saying is, let's just wait until, I think our next meeting must be the 27th.
Yeah.
Let's address it at the 27th to see if anything has changed, either in our favor or against the favor. That's fine.
Yeah.
Fine.
that-
Yeah.
It's not gonna make a difference.
It
not gonna make a
likely isn't going to make a difference because I don't think the data is going to change that fast in our favor. And I don't think that they'll meet before the 9th.
And I think it'd also be useful in terms of just transparency, just to have that as an agenda item where we will vote on, and maybe I'll see the lots of word here. So 2 weeks from now,
Sure.
it's all clear. But yeah, but I think we will end up in the exact same place 2 weeks from now versus here.
Right.
But if there's no practical effect, then I would suggest that we exercise a little caution, hear from more folks and see what's happening in the community.
Yep. The one thing that I will add is, since the landscape has changed, to some of the Board of Health members' point, I'm kind of thinking that like a trial, like once we get going and the numbers come back down, as they very likely will, like it might not be necessary at that point in time to actually have a trial where then all of a sudden the masks go back on and we reevaluate it. Maybe just we're actually mask optional at that point in time, since we have a metric to put them back on in the event the numbers go the other way. Like maybe we want to use these next 2 weeks to think about, do we even define it as a 3-week trial? The reason it started as a 3-week trial is because we basically had 14 school days before Christmas break. Then we got backed into the corner on January 18th, and now we're February 9th. And then the other thing I believe everyone saw it because Jen sent out the email, the change on the DESI 80% threshold. So it used to say that only vaccinated individuals could participate in optional masking. The wording has changed. Now it says unvaccinated individuals are strongly recommended to continue with masking, which maybe more will come out in 2 weeks on that. I don't think that was an accident. I think that that's sort of them tipping their hand as to sort of student equality as it's going to relate to this.
Well, that's the kind of thing I think we should have on the agenda and let the committee know we'll discuss and then debate about how we want to word that moving forward in 2 weeks.
Yeah.
I think that's a substantive issue more so than just let's run it since it's back.
Because I do think that if COVID-19 is going to be here forever, at some point, unvaccinated individuals are going to have their masks off at school too. So I don't know when that is, but it's likely going to happen.
Certainly worth a conversation. I think that brings us up to the circuit breaker update for.
Sure, just give me a second to get it up. Right, so 2 meetings ago, during the budget update, there was a question on circuit breaker and how much we expended, and instead of just providing that simple answer, I thought I would just take a couple of minutes just to explain and update everybody, so everybody is aware of what circuit breaker is. It'll be a very quick presentation. So basically, and I won't read it all, circuit breaker is basically a way for the state to reimburse districts for high-cost education. It comes in the form of a reimbursement after the fact. And circuit breaker has been around for many, many years. Before 2004, there was a different program, but the state has always supported special education costs to the districts. How does circuit breaker work? Basically, we get reimbursed as a percentage of a percentage. There is a threshold that we have to meet first. It's a minimum threshold. That number is $44,000. I believe it's $47,000 now. But so what happens is we get reimbursed on a portion of dollars that is over that threshold. So the reimbursement rate is typically the law is written at 75% reimbursement. That rate has fluctuated up and down over the number of years. The superintendent can attest to that. Some years it's been down to 50%. Very rarely have we hit the 75% reimbursement. That has changed. What also has changed for this year, for the FY22 reimbursement, is we are now receiving reimbursement for special ed transportation costs, which is new. That's as a result of the Student Opportunities Act, and that's having an impact on our reimbursement as well. As a quick example, for instance, if it costs $85,000 for an out-of-district placement for a student, we subtract that mandated threshold, the difference, we take the difference in this case, in this example of $40,000, and then we take 75% of that number, and the district would receive a reimbursement of a little over $30,000 for that student. That's just an example. These numbers also now, we can include the transportation costs into that cost of the student, and that transportation is not, at this point in time, a strict 75%. The transportation is actually being phased in over a 4-year period to reimburse the districts. In 2000, so the way it works is really a three-year cycle here. We incur the expenses 1 year, we get reimbursed the second year, and Littleton chooses to save those funds for the third year and put them toward the tuition in the third year. That's basically how Littleton works it. So for instance, in FY21, which was last year, we received $922,000 in circuit breaker reimbursement. That was for the expenses from FY20. We are saving those. We saved those. We received them last year in 21. We are using those funds this year in FY22. So Justin, to answer your specific question that you asked, year to
Remind me
date,
what the question was.
the year to date was with all those circuit breaker funds that we had expended, we had received, how much had we expended year to date? So year to date, we have expended $632,000 of that 922, so approximately 68% of it. That's through December. But I will note, I looked at this and we have not received all of the December invoices from all of our vendors yet. So that number is actually slightly higher. We just didn't have that number because we haven't received the invoices. So that's a very quick and dirty how circuit breaker works. Estimated circuit breaker receipts for this year, we had eligible expenses from FY21 of 2.6 million, less that threshold, that foundation threshold. We had net claims of a little over 1.4 million. And you can see off of that 1.4 million in claims, we are going to receive a little over $1 million in circuit breaker reimbursement. We'll receive those funds this year. We'll use them next year in FY23 toward our tuition expenses. This year, you can see that we're receiving $925,000 in program costs. And then we're also receiving that additional $137,000 for that transportation cost. That's new this year. So again, I said this is going to be quick and dirty, and it is. And there's a link to the DESE circuit breaker information webpage. If you want to read about it, there's more information, and it'll put you to sleep at night. So very quick. It was a very quick presentation. I hope it was clear, and I'm glad to answer questions.
Any questions?
Just my only question is, this money is money that's being spent on special education students in district. This is not the out of
No,
district.
it's out of district.
Oh, I'm sorry. So it is the out of district. Okay.
Yep.
In district.
In district high cost kids are included in that calculation.
Yeah.
Yes, but typically when we spend the money, typically we spend it to pay the out of district tuition, but we can use it to pay for in district special education costs as well.
If it goes over the threshold.
Right.
Okay.
Make sense?
Yeah. So the number, sorry, I just want to make sure I understand this. So the eligible expenses, the 2.6.
Yep.
That's 2.6 spent on students attending one of the 4 schools in Littleton.
Nope.
That's 2.6 spent on students outside.
It could be students outside the district and students in the district attending one of our programs in the schools.
Okay, so it's all
Special
special
ed.
ed.
Yes.
Okay.
No, not all, just the high cost.
Just the
Right.
That's not a good way of putting it. The specialty programs that require services.
Correct.
So for students that, so there's a very complicated worksheet that you fill out, and every service that a student receives, DESE provides you a numerical amount of money. That's, so for an occupational therapy service, whether it's a small group or individual, or whether it's an OTR or a CODA, they apply a certain amount of that, whether it be $37 or $63. So then you fill out that entire worksheet based on the services the students receive to see if they meet that threshold for reimbursement. So in-district students, you would complete that, and then for out-of-district students, you go through all of the costs associated with their tuitions and their invoices, and if they have any ancillary services in addition to.
Okay, thank you.
Thank you, Lynn. All right, thank you.
Thanks, Steve. That's gonna move us to our presentation on MCAS. So. let's move this.
So a topic that won't put us to sleep, MCAS. We'll talk about the 2021 briefly. So we'll just go over some brief important information just to give you some perspective. Hopefully you've been able to look at the slides and the information provided. And so we're just going to give you some really important highlights, and then we'll open the floor to everyone. So for the packet, the presentation in the packet, if we can go to that next slide, please, Steve.
Sure.
It's in the order that's presented there for you. So I will do the highlights in this order. So I'll give you some important overview information, and then we'll have Principal Temple come give a highlight, Principal Everhart give his highlight, and we'll ask Dr. Huntington to wrap it up with the high school highlights. So MCAS is a snapshot in time, right? It is a moment in our students' academic lives. We don't receive the results until months after the students have taken the exam. So important to know, the students take the exam in the spring, we don't get the results until actually the following fall. And this year, 2021 MCAS was particularly unique because of a variety of things. Additional changes that DESE made to the assessment, participation rates varied more than in previous years. There was a choice of remote or in-person testing for particular grade levels, and also it was during a pandemic. So MCAS is stressful no matter the year, and then you add a pandemic to standardized testing, and it can create more stress and more anxiety. And with that, our students had recently gone back to in-person learning if they chose to return to in-person learning. So they were making that adjustment from only a couple of days of in-person to a full 5 days of being in-person. So there was a lot happening, right? And we need to keep all this information in mind when we're looking at these numbers. But I want to just point out and acknowledge our numbers are looking very good. It is important to acknowledge the hard work of our students, of our educators, of our building administrators who organized, planned for, and participated in MCAS last year. It was a busy time. And so I appreciate everyone's effort to make it happen. So in the next slide, just a couple of brief, you read it, so I'll just give context to a couple of items here. The purpose of last year's MCAS was diagnostic to support students. There was no other, DESE was very clear about last year's purpose. So we were to find out where the students were at so that we could support them with that data of where they are at that moment. The assessments were shortened in grades 3 through 8. Instead of 2 sessions, they only had 1 session. So basically they were taking half of the exam. Important to note for when we start talking about comparisons. It was computer-based testing for everyone, except for those students that tested in biology. And you can see a breakdown of remote testing in grades 3 through 8 of those who opted to test remotely and those who opted to test in person. We need to be cautious when we're looking at this. I've said it, I'll say it again. Really for 2 big reasons, for several, but 2 big that I want to point out before I pass it over to Principal Temple, is that remember that you're comparing different cohorts when you compare year to year. And so particularly with 2021, it's actually a 2-year cohort jump when you're looking, right? So there's no MCAS 2020 data to even look at because MCAS was not offered. So you have to go back to 2019. So that's a 2-year cohort jump. And remember that in 2019, it was a full typical MCAS test for grades 3 to 8. In 2021, it was half of a test. So just keep that in mind. And that's really the second part to keep in mind when you're looking at our Russell Street and our middle school data. So I think I've provided enough of an overview to those numbers, and I will pass it over to Temple. Yes.
I just have, what does no accountability reports mean?
Great question. So we, as a public school, we are held to accountability standards, and every year we're assessed on an accountability standard. And so what 2020, because there was no MCAS ends up being a big part of the accountability system.
Yeah.
There's several pieces. And so they opted not to run the accountability system in 2020. 2021, because of the change of the MCAS and a variety of other reasons, they opted to not run the accountability system.
Okay.
So we're back this year. To our knowledge, the most recent update that we have received is that the accountability system is running this year.
Yeah.
But the 2021 data is a hold harmless. So anything that was provided last year will.
So is that another way of saying we're doing the test, but they don't count? Because that's what I remember last year. Like, we're gonna, last year was like, are we gonna do the MCAS? Okay, we have to do the MCAS, but the MCAS don't count.
Our schools.
Is that what that means?
Our schools are rated by the state.
Okay.
Like that.
Yeah.
Okay.
Yeah. Perfect.
Thank you.
Thank you.
Hi. So that included all of the charts and things going forward, but I'm going to jump right past that. Just to the general impressions. As Justin just said, I remember back to last year, that was the first question in the fall. Are we doing MCAS? So for the teachers, and we were, and the format was different. And so, overall, when I look back and review, our participation rates were excellent. We had 359 students pass last year, and with the amount of students that had home doing school remotely, we were really pleased about that. And we were not sure what to expect, but we were very encouraged by our results. Our students were very strong in ELA, as I indicated there. 348 met, partially met, or exceeded expectations. Math was a little bit lower. In math, 318 met, partially met, or exceeded expectations. Go to the next slide. So I think we have to keep in mind that the MCAS results are the first real results that teachers get the following fall, right? So the kids take the test in the spring, and then the MCAS results come in August, and teachers are looking through to see how their students did. And so we have the information of which students, where everybody fell in that list, and the information goes home to parents as well. So that's kind of a first data point. Teachers look at their class rosters, and then they can go and see where kids kind of fell in the MCAS. Keeping in mind that we have MAP test scores, as we talked about before, in the fall and winter and spring, and we also have Acadians testing at different intervals throughout the year. So MCAS, as we've said year after year, is just one data point. And last year, it was one data point that we had. But again, we were pleased with our results. As I indicated, teachers can use the test to determine specific skills that need to be addressed in their classroom right away. It's important to remember that our third graders take the test for the very first time, and that they're using the computer as well. So sometimes you have to wonder, is it a test question or is it a function of the computer for some of our young ones? So teachers do incorporate MCAS practice type questions in their lessons all throughout the year. It's not that we wait until the spring and suddenly do a quick MCAS review. They incorporate questions that look and sound like MCAS questions all throughout the whole year. And we also practice on the computer throughout the whole year. So that's really important for us. We talked about it just today in our leadership team meeting as well. That's also true for students, for our students with disabilities, and also for our English language learners. And the additional point, again, is that we do have other scores that we get in winter and spring. that we use for specific skill development as we work up to MCAS in the spring. So those are our initial thoughts and our next steps.
If you want to wait till the very end, or do you want to ask questions at the end of each brief presentation?
I have some holistic questions. I think they're more broadly based. I don't know if you, I do both.
Oh, we can do both if you want.
You might be the only one talking about third graders, so
Yeah.
maybe we can ask
Yes,
third.
I am.
Yeah. So it's interesting that you say, that they're taking the test on the computer, but actually those kids when they were in second grade, or when, they got really good at the computer.
Correct, yeah. And
They're
this
the
is not
they're the
testing.
strongest cohort to ever come through with computers, because that's how they survived the school.
Yeah.
I guess just one point of clarification, did we not practice the MCAS questions in the school year?
Oh, no, of course.
Because-
We've been doing it for years, yeah.
No, but did we not practice the MCAS questions because we were hybrid and it was or did we? Did we get the same level of practice? Did the kids get the same
I'm
level of
not sure that they
exposure?
had that. I mean, I think teachers were hanging on by their fingernails at that point. And at the beginning of the year, as I said, we didn't even know, like, it was all over the news that we weren't going to do the test, and then we were, and then we weren't. And that every time I saw that, I said, are we doing it? And it was actually quite late when it was decided that we were gonna do it, the format was gonna change. So, I think that the MCAS type questions are incorporated into what the teachers do routinely all the time. So, I'm sure that kids practice MCAS type questions. Teachers are getting into the practice of writing their regular assessment questions in that type of format anyways.
Mhm.
So I'm sure that they had practice.
I think a little greater clarity is in order here. We don't, for lack of a better word, spend 2 weeks cramming for MCAS. What we do is we incorporate what's going to be covered on MCAS, the types of questions they're going to ask as we teach the units throughout the course. So it becomes part of what we do throughout the year.
I can appreciate that. Like, we've heard the expression, you don't want to teach the test.
Right.
But if you know what's going to be on the test, you certainly want to make sure you get it covered.
Right.
I suppose my follow-up question was, as I roll through the third, fourth, fifth, like, there didn't seem to be a huge discrepancy, and this is kind of a common thread for Jason, for you, on the ELA, but the math scores really suffered. So do we think that it was just harder to teach math than it was ELA, like in a hybrid situation or remotely, or?
I would say yes, just with all the remote and the hybrid situations that we were dealing with. Also, just thinking back, it's hard to think back to all of those struggles, but how are we going to use manipulatives when we use it? We were packing up little bags of counting things to send home to kids in third grade. So some of the things that we had to work out just differently than we would under ordinary circumstances like now. A lot of that is the things that we were able to reincorporate this year, thankfully, in our classrooms. We were so worried last year that kids couldn't share items in the classroom. And now we're not doing that this year. It's okay to have manipulatives at your desk this year. So that was a struggle last year for us. So I think there was just some of the strategies that teachers used were negatively impacted at the beginning last year.
And that's not a total surprise, given the math scores that we saw and given the scores nationwide. So while it is right, there was more decline in math than there was in ELA. And I think part of the reason is what Ms. Temple is saying. Part of the reason too is at home, we can read with our kids, right? I think it's more innate, it's more natural at home to say, let's go get a book and read, right? So those skills were being practiced potentially a little bit more in some homes than other homes, which led to this gap, a stronger gap in math than in ELA. And we've seen it across multiple testing platforms. And not only across our district, which we saw through math growth as well, but across the state of Massachusetts and nationwide as well.
I want to be careful here because when you look at these sheets, it's almost innate for you to compare the scores as you go horizontally. And there's no meaning to that because they're different grades. So in order to really ascertain what this particular class, grade 6 had done, you'd have to go back and trace when they were in grade 3, in grade 4.
But we have data to do
grade
that,
5.
and I didn't chart it out, but you can see,
You can.
you can see it, and you can see a deterioration
Right.
or not just, the troubling thing for me is the number of kids, especially in math, who were just not meeting expectations. When you're getting in the 12, 15, 16% in some of these areas, I am completely skeptical of standardized tests. I know it's a snapshot. I know this is a really fuzzy snapshot with only half the pixels of others. I got to get it all. But it's that thing that you're talking about right now that worries me a little bit. And I have larger questions about how this correlates with math testing. But it's because you can see the third graders in 2018, their bar graphs look different 3 years later. And there's more red than there is blue. And that's something I think we should not be alarmed about, but we need to know, I think.
And we do, but and our math testing helps tease out those details.
So that's the question. I'll be quiet now, so we get to the question here from everybody else. But that's my question as to what degree this correlates with the math testing. Because I believe, Ms. Steele, you talked to us before about how math testing was showing more deficits in math than in ELA, but if I recall correctly, 2-3% kind of drops instead of these more significant changes.
Yeah, exactly. Do you want me to go into that?
I'm sorry.
Well, it goes in, I mean, math growth, I think, goes into the skill set a bit deeper and wider, right? So we're getting a better picture, quite frankly, in the moment of where our students' skills are when we look at that. And what's interesting is that it's almost the reverse. So when we look at our math growth scores, they're able to indicate to us, this student most likely will be achieving at this level on MCAS. And so we're able to see that once the student takes it in the fall, where math growth thinks they're going to be and the skills that they really need a little bit more work with. And so we can harness in on that.
And that's more real-time data.
Yeah.
And we think as standardized tests go, again, skeptical, but that's a more reliable assessment, we think, of their skill.
Yeah, I mean, it's technically not standard because not everyone's taking the same test. So
Understood.
it sometimes seems standard, but it's technically not a standard test because it's responsive to the students' answers. And so it gets, if you answer so many incorrectly in a row, it starts going at it with a different angle.
But it's specific to skills. You can track specific skills with math testing, so that's the important part is if a specific student has a weakness in a specific skill in the fall, then the teacher knows in real time, can work on that, and then it gets reassessed in the winter.
And then again in the spring.
And then again in
That's our
the
thought.
spring.
I think you're good. You're good.
Thank you so much.
Okay, middle school. Yeah, Steve, if you want to go through those slides pretty quickly. Usually when I give this presentation, I have spent dozens of hours poring over the data. Like I take that as a source of pride of just tracking cohorts from the time they started testing to where they are. Like I really believe you can tell a lot by looking at the grade compared to itself as opposed to year to year. And so with this test being the way that it was, it wasn't even really worth going through that. I did it kind of preliminarily, I did a preliminary analysis of it just to kind of see if there were anything that really stood out. I wasn't surprised by it that I saw. In the test last year, we had great participation rates in grade 6 and 7. Grade 8, you have a lot of students opt out. But yet, even with all of that, we still did better than the state in most every category. And I'm not even sure what that's really worth, to be perfectly honest, because you're looking at it compared to towns that aren't anything like ours. I wouldn't say the third bullet point was the one that I really wanted to address. We had a lot of staff shortages last year. I mean, there were points where I was emailing families at like 7:45 in the morning saying, we don't have a math teacher today. Or we're not going to have one all week. And the families were amazing. And so, doing some of the stuff that we were able to do, given what we had, you know what, the numbers, they may not always look great, especially in math, but when you're talking about going weeks without having, somebody in there to teach the class, these kids did a great job on their own, right? Supported by their families. And I think that's the part that's the real takeaway for me is that despite all of the challenges and obstacles, I think our scores, are pretty good given everything that we had to deal with. And I think
there's a lot of talk about learning loss and are we going to be behind the eight ball, come this year. And I'm not worried about it. Having done math classes all year and seeing what our kids are doing, they've really picked up, and our teachers have really done a great job of incorporating a lot of that. So I'm not worried about learning loss on any level. We had a lot of staff dedication, and our technology program, we got really lucky because we had piloted a one-to-one program at the middle school just shortly before COVID came out. So we didn't have to go through the trial of trying to do all this. And so we were pretty happy with that. And so it wasn't as much of a stretch, but not knowing what the format was going to be like, we weren't really sure what to prepare for. And to be honest, with the test, I don't know what it was like at Russell Street or at the high school, but at the middle school, normally they will take like an ELA test. It's a 2-session test, right? One session one day, one session the next. So they did the one session, but not all kids got the same test. Some kids took session 2, some kids took session 1. So when you look at the scores, you can't even really glean anything from that because an entire grade, half the kids took one session and half the kids took another session. So you can't even compare the kids to each other. And so that's what makes this really difficult to even assess, is because they didn't all take the same test. You can go to the next slide, right? But really what we're doing is we're really looking at what we're going to do moving forward. And so, as we get ready to prepare for this next MCAS, thankfully we don't have the staffing issues that we had last year. We're in a much better place. Having the kids be back in school makes, 5 days a week has made all of the difference, especially this year as we talk about, let's say math, for example. My wife being an 8th grade math teacher really struggled last year to teach math virtually. There's just some things you just can't replicate. And you can try and, you use all the technology, you can try your different ways, but the kid wants to turn off the camera or turn off the screen. There's not a lot you can do about that. Where in the classroom, you can re-engage, right? You can nudge, you can get kids involved. And so that was something that we lost last year. And so I expect a tremendous growth in our schools going this year. And, in regards to math, we really rely on that because we use that to decide how we want to support kids. So if a student in the fall does poorly on a math or ELA test, we then can have services provided, whether that's going to our academic support center, or whether that's, taking them and putting them in math lab or lit lab. We could do that in real time. So we're providing services. With MCAS, you're finding out the next year, and a third of your kids have gone on to the next school. So you get the results back, and what am I supposed to do with that? And you can't really use the test the previous year to prepare for the coming year because the focus might be completely different. So when it comes to it, math is what we really should look at. And I remember a couple of years ago with the school committee, there was a vote to kind of say we're gonna rely more on that test than MCAS moving forward as a judge of how well they're doing. So the other part too is we have a lot of new teachers, so it's going to be incumbent upon us as administrators to work with our teachers to help prepare them for this test and get kids ready to go. And with some of the additional delivery systems that we put into school, we really are feeling we're in a very good place for this next round of testing. So I look forward to having an excellent MCAS season this year. Questions?
Actually, I do. We, especially this point about the teachers, we had questions as a school committee about use of PD days and stuff like that. I've noticed, Steele talked to us earlier in the year about having people work as teams and as within curricular departments. Are you seeing some of your PD time to deal with, to really kind of focus in on how to address kind of common gaps?
We haven't really done it necessarily at the school level in terms of breaking people off into their departments. So like, for example, our science department, all 3 teachers are in their first year or their second year at the middle school. So there isn't really, you don't have that veteran teacher that's there to guide. So what we try to do is work individually with the teachers by going in and making classroom observations, following up with the teacher to say, hey, listen, this is what I noticed. What do you think about this? And working with teachers on an individual basis. I spent 17 years in the classroom. My assistant principal spent 17 years in the classroom. So between the two of us, 34 years of experience of being able to work with teachers. And so that's the approach we've decided to take. And then really hoping the teams lean on each other within a team. So you may have a science-specific issue or a math-specific issue, but a lot of what we're talking about are classroom management issues, right? We're talking about engagement issues. How do you get kids excited about a subject? That happens. Those strategies are the same regardless of the subject. And so we look for teams to lean on each other to bring each other along that way. Yes. All right. Thank you.
Thank you.
Come on down.
All right, so the next slide. I'm actually going to start with the ELA slide, and just sort of, and then I'll give my impressions as we go through this slide. You've got a chance, in your pack, you've got a chance to look at it, but keep it up there while I made a few comments that you'll notice, and for the public's attention. Again, I want to express my, as we always do, when we share results at the high school, express my gratitude, especially to the students, their hard work and effort during a very difficult time. That, express my gratitude, appreciation, and pride in the staff for navigating students through all this. To really have some, and thankfully, no significant surprises, consistent, compelling performance for the high school, given the circumstances. 26% of this cohort was exceeding expectations of the ELA. It's a different cohort, but it increased from 10%, increase of 10% from 2019. 84% meeting or exceeding expectations overall in the ELA. And really proud of the fact that zero students not meeting expectations in the ELA. That's a great stat to have. We have students we know who need intervention and help, 16%, and we're working on that as we often do. We identify what their needs are, just like any other year. Moderate growth in terms of the Schcmte for this cohort of 42. Solid performance for high need students. None of them scored not meeting expectations category, which is great. So huge shout out to ELA. Go to the next slide. Mathematics. Again, proud of the math department. Hard work of the students. 23% exceeding expectations. Decrease of 5% from 2019. That cohort. 81 to 82% meeting or exceeding expectations combined. Depending on what report you're looking at, it says 81 or 82% because of a student that might have been not included in the report. Sometimes you'll see those little stats like, why is that off by a couple of percentage points? See state reporting, or you go to the state website. 60% meeting expectations. 18% partially meeting expectations. Hey, we've acknowledged all the issues with mathematics and difficulty, the challenge of teaching it virtually in a hybrid format. Astounding performance considering everything that the teachers and the students are going through. Moderate growth, median Schcmte, student growth percentile of 48. LHS had a higher score on every question compared to the state. That's reported from the department chair, department coordinator Elizabeth Rigo. She also expressed on behalf of the department that overall we're really happy with the results, especially given that this exam was taken in the middle of a pandemic. Next, we'll go to the biology scores. This was a legacy test, paper-based. Really happy with participation rate across all the tests, considering the opt-out option that the parents had, students had. 62% advanced, 91% advanced and proficient combined. 8% needs improvement, and a very small percentage, barely 1% warning or in the failing category. LHS significantly outperformed the state, solid performance for high need students. None of them failed or had scored in the warning category. Very small number of high need students scored in the improvement category. So you can see the difference in how this is a legacy test, so the categories are different, advanced, proficient versus meeting expectations, exceeding expectations. So the next slide, please. Thank you. I've already sort of gone over our impressions as we look at the grids. Again, just some things for you to sort of capture. I've already said this, but just take a look at it. Achieved similar results as pre-pandemic and exceeded in some areas. Next slide, please. LHS next steps. Instructional adjustments as needed. Dave Pascucci, department coordinator for ELA, shared that the department wants to use more pointed instruction around multiple and complex tests, particularly nonfiction. That would prepare students to handle intricate writing tests. So to your point earlier about how we use PD and how teachers collaborate with department meetings, they looked at these results and they said, what do we need to do? What do we need to tweak? What do we need to do?
That's how you can work with social studies, especially.
Yeah, sure. And continued early intervention, as we always do at the 9th and 10th grade, especially looking at middle schools that they come up with their results in 8th grade, say, so who's going to need some extra support in that 9th grade test? And some kids, we have sort of a 2-year preparation process for the 10th grade ELA and math. We've introduced math testing in ELA. Beth has already made a presentation about that. That's very important for us. And Alex in mathematics is a program that we've been using for a number of years. It's quite helpful.
to keep students practicing different types of problems and adapting to different circumstances. Continued preparation for the next generation of computer-based testing in English and math, also in science and technology and engineering. The chemistry test is going to be discontinued in the future. So this is the last year will be offered. There'll be a physics-based test and for biology. We're going to continue to test in the biology category. Following up with students in the class of 2023 who did not score proficient or in the meeting expectations category for math and ELA. That's something we do every year, regardless of the cohort, but that's something we need to do for sure because it's a state requirement. That is LHS's. Question.
Right. You want to go first?
No.
So this was the surprising part of the presentation because the scores were actually really good.
Yeah.
And I was gonna make a joke that there's something in the water, but we made that joke last time. And it's in the groundwater, not in the drinking water.
Yeah.
I don't know if it just kind of hammers home the point that 10th graders have a little bit longer attention span and were able to sort of stick through it the entire year. And maybe some of the younger folks, the younger kids weren't as successful at mastering some concepts, but you know, all in all, I think that these results at the high school level were phenomenal. They were better than expected after seeing the Russell Street and middle school.
So this is the time we say every year, Dr. Clinch, you will know what I'm probably about to say, he's predicting. It starts young. All right, it starts Shaker Lane, Russell Street, middle school. It's a system-wide district approach. Because by the time they get to us, we get to, you know, I've been here a while. And I've always been able to give shout outs to my colleagues and the teachers at the other schools because we're sort of that's where we want to be when they get to high school. Yeah, they might not have the best scores across, you know, at third grade, one kid, and then he or she approves, and then when they get to middle school, you can see the growth. But you know, that's the proof, is the outcome when they get to high school. We're graduating, most of our kids, pretty much all of our kids pass the MCAS. That's of course the minimum we want, but they go well beyond that. And they're going on to great things with high school outcomes too in terms of graduation. So this is a credit testimony to the system-wide preparation.
That's nice. And I, you know, sharing, not basking in the glory, but sharing it is probably the right approach. So what does early intervention mean for 9th and 10th graders? When I hear early intervention, I think, you know, trying to get something.
Oh, we're looking at their scores and looking at their reports. So one of the things I mentioned earlier in Dirk when I was commenting at Jason, because we'll look at the scores in acre for the 9th grade and say, and we'll have those teachers ideally will be transition meetings. They'll talk about them, especially look at high needs students, special education in particular, ELL students, anyone in the high needs category. We're looking at scores, identifying students who might not be performing well academically. Look at their coursework. How they're doing in class, monitor their progress more carefully. The special educators do an extraordinary job. And I think I probably should compare us in that one category to other schools as a way to do that, that have similar demographics to us. Because every year their performance is just amazing in that category because those students with the highest needs struggle academically. They're always the most motivated. But they're left with reading or doing work. They're not motivated for different reasons. That's not, you know, typecast because there are a lot of hardworking, motivated kids who just have academic issues or cognitive issues that get in the way. But our teachers are able to pull them across that passing line every year. It seems just remarkable record of high performance. But early intervention is really that, identifying kids. And then who didn't do well in the 9th grade? Who do we have to keep them? So we're putting some special courses in some cases that offer more support. A couple of years ago, we offered an academic support center, a tutoring center. Those are the examples of interventions that we have put into our school institutionally over the last few years. That's what I mean by that.
Great, thank you.
I have a question.
No.
It's more system wide, I guess. And so I guess it's to you. You know, I was borrowed Jen's computer just to make sure I was remember correctly. But the district profiles on DESE report out allows us to see how subgroups perform. And I'm wondering if there are any demographic trends that we as a school committee need to be aware of? Or if there's subgroups that, now, I mean, just, you don't even have to say it out loud, but are there groups that are performing better or worse than other groups that we should know about?
So it's fascinating. We apparently all share brains. Because before
I'm so
the
sorry.
meeting, no, it's great. Lynn and I were having conversations about subgroups and, you know, what is it looking like in trends? And so Lynn did a little bit of a dive before. Do you want to share kind of
I did a shallow dive into the
Okay.
not a deep dive. Do you want me to just say a couple things about it?
I mean, again, to the degree you're comfortable talking about this, that's often really revealing when I look at these data.
Yeah, that would be great. So just taking a preliminary look, it is looking like we're showing the expected growth. The thing is that the data set, especially when we're looking at subgroups, is a really difficult data set to look at because there's no comparative analysis that we can really try. We're looking at two years ago where the students are in 2 grades lower. So it's not something that you can really analyze and pull something really kind of deep with a lot of depth out of it. But I did kind of go through because this is my first time really looking at MCAT scores for the district, and that kind of prompted the question. I said, you know, what do our subgroups look like? How are our students with disabilities performing? And so we also had a call with Keith earlier too to talk about that specifically at the high school. And so it is looking like when we do look across the scores with students with and without disabilities, it is commensurate with students without disabilities. We are outperforming the state, and we are somewhat commensurate with the town when we pull out our SPED subgroup. The thing that we need to look at, but what we are expecting is we're going to have a higher percentage of students that are partially meeting and not meeting. We're going to have a higher percentage of students without disabilities, partially meeting and meeting and exceeding. But I didn't see anything that I didn't expect to see is what I can say kind of preliminarily. And I think John had a couple
I actually
comments.
looked at it too. I can comment just at the high school. You know, proud of the fact I've already given a lot of shout outs to the special education department historically and of course this past year. But if you look at the state grid and if you look at the subgroups, you'll see high needs, students with disabilities, socioeconomic status, ELL, different categories. They even identify categories by gender. Well, keep an eye on the gender thing a little bit, because that sort of caught my interest about males in some cases not doing as well as females at LHS. And for example, but the other thing to keep in mind, Brad, when you're looking at those percentages, they can say, well, 33%. Remember, our school's small. So 33% of 15 kids. So you're talking about 5 kids, 33% of 11 kids. That's, about 4. And so but we know who those kids are. That's what's unique about us and a point of pride for our school. So we did look at the students who, and when I mentioned those percentages, those are the students not making, partially meeting expectations. It's in the single digits for percentages when it comes to not meeting expectations at all. So it is something we look at with the subgroups, but I hope that provides a little bit of.
It does. And I wasn't trying to put you on the spot. I just want to make sure we're ready to
Small sample sizes though always are a factor.
understood.
I have another comment that's actually kind of piggybacks on that. Actually, one thing that I did see that was notable that ties into that is that the number of students that are going to not meeting dramatically decreases because there are these few students that we really can hone in on and really provide some prescriptive interventions. So when they get to the high school, when it does become higher stakes and meaningful because it ties into a graduation requirement, the special education staff are really doing an incredible job knowing exactly where those students need to be and what they need to do in order to pass MCATs. And even if they need to do a retake, they are able to really come up with individualized plans to get them there.
So there is one area that we're really watching closely, and our demographics are changing in town, and our ELL population is increasing. The superintendent, I monitor all areas, but that's just an area. It's not an area of concern, but because we're increasing in numbers, I want to make sure that the programs that we have attacked are exactly what we need to help the students move along. And it's not uncommon for us to have a student move into our high school that doesn't have any fluency in English. And boy, if you put yourself in those shoes, could you imagine being transported to another country and you didn't understand a single word of So we're finding a little more of that, but we've had lots of conversations, Lynn and I, and we've had some changes in our ELL staff. And not because we needed to, it's just the way it happened. And we're moving in the right direction, but it's certainly something I want to keep on pulse.
Should update on our January 27th meeting, our next time we will be having a school-based wellness update. That's something to look forward to. And that brings us to our second opportunity for interested citizens. And hands raised, Dorothy. Okay, and we'll do subcommittee reports. PMBC,
No update.
budget.
Budget. Steve, you want to give the budget? There's been so much going on with everything. Like, yes, there's something to report, and I'm going to yield my time to Steve Martin. I'm going to update everyone where we are with town.
There is a joint budget subcommittee meeting coming up in early February, February 5th.
Super Saturday.
So there will be some discussions there with the town regarding the school budget and capital project as well. We did submit our budget request to the town. I don't have the number. Oh, do you want me to give you that number? It's 460,000 roughly and some change. That's the requested increase to the appropriated budget for next year for the FY23 year.
Which is about a 2% increase.
It's a 2% increase. We're in a very good position, both this year and next year, with that request. So we haven't heard feedback from the town at this point in time, but based off the town's initial budget models, that's a number that is significantly less than they were budgeting and planning to in their initial budget model. So I think that'll help the town out significantly over the next year. So
Thank you.
capital projects, we're moving forward as well with our capital requests of the town. That'll be reviewed on that Saturday as well. So yeah.
Thank you. I didn't mean to put you on the spot, but
That's
I
okay.
think you do a good job of it.
Excellent. And policy.
We have a meeting scheduled for next Wednesday, I believe. I'm asking someone, we'll get my calendar, so policy subcommittee everything next Wednesday.
I think it is.
I believe.
I think it is.
Yeah, and actually I'll send you an email. There's something that came out of CPAC meeting, something I want to get on that policy.
That's anything else you want to update on CPAC?
I do. We had a really good meeting on, when was there for it?
Tuesday.
Tuesday. Really good meeting, long conversation. A couple things came out of it. One is we have some workshops coming up. In April, there's one on a speaker on collaborative problem solving. We're going to have a meeting, the April meeting, we'll talk about the elections that we'll have to elect a new slate of officials, officers, and that'll happen in June. The most important thing I think that came out of the CPAC meeting was a conversation among the parents about how their kids need more opportunities after school. And it's something that we hope the school committee or CPAC can work with Parks and Rec and maybe work with other school districts around. Sometimes like the Parks and Rec stuff that they already have, like the 4-4 basketball, just too stimulating for some of the kids, but they still want and deserve opportunities to interact with peers and develop skills and to play. And it's something I think we as a CPAC and we as a school committee can use our official voice to ask for and to leverage for. So that's something we will be working on. And for members of this committee or members of the community who want to be part of that, you can reach out to CPAC. Elvis.
That brings us to our adjourn. There's no need for an executive session tonight, so.
Move to adjourn.
At this
Second.
point, at this point, I'll take a motion to adjourn.
Are you good?
You jump. You got it.
So I'll move to adjourn.
Thank you.
I'll second.
This is a roll call vote. Justin,
Justin McCarthy, yes.
Similarly,
Gracias, yes.
Jen,
Jangle, yes.
Bradley,
But for now, I'll vote yes.
and I would just, well, we'll see you on January 27th.